and straight into my arms you will run. And when you come, my heart will be waiting to make sure that you're never alone. There and then all my dreams will come true, dear. There and then I will make you my own. Anytime I touch you, you just tremble inside, and I know how much you want me that you can't hide. Can I just have one more moon dance with you, my love? Can I just make some more romance with you, my love? Well, I wanna make love to you tonight. I can't wait till the morning has come. And I know that the time is just right, and straight into my arms you will run. And when you come, my heart will be waiting to make sure that you're never alone. There and then all my dreams will come true, dear. There and then I will make you my own. Anytime I touch you, you just tremble inside, and I know how much you want me that you can't hide. Can I just have one more moon dance with you, my love? Can I just make some more romance with you, my love? Can I just have one more moon dance with you, my love? Can I just make some more romance with you, my love? I just want one more moon dance with you. Summer wind came blowing in from across the sea. It lingered there to touch your hair and walk with me. All summer long we sang a song, then we strolled that golden sand. Two sweethearts and the summer wind, like painted kites, those days and nights went flying by. The world was new beneath the blue umbrella sky. Then softer than a piper man, one day it called to you. I lost you to the summer wind, the autumn wind, and the winter wind. They have come and gone, but still the days, those lonely days, go on and on. But guess who sighs his lullabies through nights that never end? My fickle friend, the summer wind. friend, the summer wind. Ooh, that summer wind, warm, warm summer wind. That summer wind. As long as you live, someone who loves you tender like I do, and you'll never find, no matter where you search, someone who cares about you the way I do. No, I'm not bragging on myself, babe, 'cause I'm the one who loves you, and there is no one else. No, no one else. And you'll never find. It'll take the end of all time, someone to understand you like I do. No, I'm not trying to make you stay, babe, 'cause I'm the one who loves you, and there is no one else. No, no one else.
You're gonna miss my
You're
love.
gonna miss my
You're gonna miss my love.
You're gonna miss my
You're gonna miss my love.
You're gonna miss my love. Miss my love. You'll never find
Never find
another love like mine.
another love like
Someone who needs you like I do. No, I'm not bragging on myself, babe, but I'm the one who loves you, and there is no one else, and there is no one else. No, there's just no one.
one else. You're gonna miss my love.
Miss my
You're gonna miss my love.
I'm gonna miss your love.
Oh, yes, you are. You're gonna miss my love.
I'm gonna miss your love. When marimba rhythms start to play, dance with me, make me sway, like a lazy ocean hugs the shore. Hold me close, sway me more, like a flower bending in the breeze. Bend with me, sway with ease, like a flower bending in the breeze. Bend with me, sway with ease. When we dance, you have a way with me. Stay with me, sway with me. When marimbas start to play, hold me close, make me sway. Like an ocean hugs the shore, hold me close, sway me more. Like a flower bending in the breeze, bend with me, sway with ease. When we did, you have a way with me. Stay with me, sway with me. Come fly with me, let's fly away. If you can use some exotic booze, there's a bar in far Bombay. Come fly with me, let's fly away. Come fly with me, let's float down to Peru. In Lama Land, there's a one-man band, and he'll toot his flute for you. Come fly with me, let's take off in the blue. Once I get you up there, where the air is rarefied, we'll just glide, starry-eyed. Once I get you up there, I'll be holding you so near. You may hear the angels cheer because we're together. Weather-wise, it's such a lovely day. Just say the words and we'll beat those birds down to Acapulco Bay. It's perfect for a flying honeymoon, they say. So come fly with me, let's fly away. Oh, come on and fly. Once I get you up there, where the air is rarefied, we'll just glide, starry-eyed. Once I get you up there, I'll be holding you so near. You may hear all the angels cheer because we're together. Weather-wise, it's such a lovely day. You just say those words and we'll beat those birds down to Acapulco Bay. It's so perfect for a flying honeymoon, they say. Come fly with me, let's fly. Pack up, let's fly away. Wise men say only fools rush in, but I can't help falling in love with you. Shall I stay? Would it be a sin if I can't help falling in love with you?
Well, good morning. Welcome. Today we will start the talks in the area of population of production medicine. The first talk will be navigating bovine health status in Mexico, a multi-disease diagnostic strategy by Dr. Carlos Gutiérrez from Mexico. Dr. Carlos Gutiérrez Aguilar, he obtained a degree in veterinarian and his master's degree in animal production at Faculty of Veterinary Medicine at the National University of Mexico. He completed a PhD at the University of Edinburgh and a postdoctoral degree at the Roslin Institute in Scotland. In 2005, he received the National University Distinction for Young Academics. Nowadays, he is a full-time professor in the reproduction department of the National University of Mexico. He has a level D of the University Academic Performance Program and level 1 of the National System Researchers. Additionally, he has been head of the reproduction department of the Faculty of the Veterinary Medicine, scientific research coordinator, coordinator of the master and doctorate program in animal production. You can start, doctor.
Good morning to everybody. Well, I appreciate that, I know that there are many very interesting talks this morning, and I appreciate you choosing to be in this one. I will present the work that we've been carrying on lately regarding viral diseases prevalences in Mexico. This work involved many people, particularly Dr. Anadelia Rodriguez, who obtained her PhD with this work. Many thanks to her. Right, just for a bit of context, calf production in Mexico is one of the most spread and socially important activities in the countryside. It involves 50% of the territory. 1.2 million families depend on this activity. It's the seventh place in the world as beef production. 80% of our exports, though, go to the United States, and we export as well live animals, 1.1 million calves every year. So it's a very important activity and economical activity for Mexico, together with, together with Colombia, Peru, Chile, Argentina, and Brazil. We export 40% of the worldwide beef. Endemic diseases then poses a big threat for this activity. It is estimated that, it is estimated that up to 20% of the production losses are due to endemic diseases. And these are due to decreased productivity, mortality, abortions, otherities, suppression, veterinary and treatment-associated costs, and commercial restrictions. This is not different, in Mexico is no different than many other countries. Worldwide, it has been determined that these diseases, and I'm talking specifically about bovine viral diarrhea, infectious rhinotracheitis, syncytial virus disease, parainfluenza, and leukosis, are worldwide distributed. And most countries suffer with these diseases. Remarkably, there are some countries that have initiated surveillance and control programs and have managed to reduce the incidence of these diseases significantly. Namely, Denmark, Norway, Belgium, Ireland, and for DBV and for leukosis, Spain are good examples. Mexico, we have had many works that have done characterizing the prevalence of these diseases, And as you can see, they have obtained varied results ranging from 69 or 40s or 30s to 98% for BBD, and similar results are for most of them. Leukosis has much less prevalence than the other illnesses, but nonetheless, they are present in most of our herd. However, one of the problems that we have when we read the literature is that most of the work that has been done is limited in the regional coverage. The diagnosed tools that are used are very varied and sometimes standardized differently. The status of the cattle that have been sampled is either vaccinated or unknown, of unknown vaccinated status. If we rely on official data, then they are also biased, as most of the official data relies on samples that are referred to the laboratory because there is already a problem. Therefore, there is a lack of a real standardized national survey that could tell us where are the diseases. We have found that when reviewing this, that many of the cases that are reported looked at that region because they already suspected of having problems. So there is a lack of a survey where the animals were characterized or studied to characterize the actual prevalence and not to combat or try to mitigate an ongoing problem. So the objective was to establish benchmark prevalences for those 5 viral diseases. And for this, we established first a serum bank from cattle samples that composed of over 30,000 samples of unvaccinated cows, and the farms were stratified by their size. Just to give you an idea of the distribution of cattle farm sizes, the median number of cows in Mexico is 22. So it's really not very big farms like in other countries like Australia or Brazil or the States. We were very lucky that there was another ongoing project and we were able to piggyback on this other project. And this other project was was trying to estimate the calf crop for the whole of Mexico. And this was paid by the government. So they had 160 veterinarians going to do pregnancy diagnosis in the farms. So we were able to piggyback on this, and we just pay for the collection and delivery of samples. And that way is how we managed to obtain this serum bank. Our first approach then was to try to know how was the spread in some of the states, in 5 states that were very important for cow-calf system production. And what we did is we used commercial ELISA kits and we used pool samples. Each sample was made of 10 animals, so an equal amount of serum from 10 different animals. And what we obtained, sorry, let me go back. So basically what we obtained is very high prevalences for all diseases. It was that high that we really didn't know what to make out of them, as we thought we were overestimating the prevalence. And let's just remember, this is not actual cow prevalence, but farm prevalence, as each sample was a pool of each farm. So each pool was from 10 cows from the same farm. So this here that you are observing at the moment are the prevalences that were obtained at the farm level, yeah? And you can see how they are very high, and for bovine leukosis, as has been mentioned, is the lowest, but still you get over 68% in the state of Chiapas. And Tabasco well, that is Neospora, so I'm not going to talk about Neospora, but what you can see is all the viral diseases, we have quite large level of prevalence. Nada más va una para atrás. Well, one of I jumped the slide there, and that slide, what it shows is that the sensitivity of these assays is that high that you will obtain a positive result even if you dilute the samples 1 in 100. That is, if you have one positive animal among 100 other negative animals, 99, you will still pick it up as a positive sample. So we know then that it was very reliable to detect at the farm level. Nonetheless, it will not tell us much about what is happening at the individual level. So our next study was, and we also know that doing that by ELISA, to try to do the whole country by ELISA, was going to be too expensive. So we developed our own assays. And firstly, we developed recombinant antigens. And with that, we developed an assays that highly efficient using a methodology called Luminex. And I'll explain a little bit about that. With this, we aim to establish the zero prevalence for the mentioned diseases. And also we assessed environmental and management factors that could impact the seropositivity for these diseases. The Luminex assay, what it does is there are these little beads that have fluorescence, and they have different ranges of fluorescence. So each different bead will fluoresce at a different wavelength. And through the wavelength, you can determine what bead it is. Then these beads, you label them with a different antigen. So say to the bead that will fluoresce purple, you label it with an antigen against bovine viral diarrhea. And the bead that fluoresces in red, you label it with leukosis antigen, and so on. So that way you can analyze many, many antigens in the same sample and makes this very, very efficient. You can put up to 20 antigens in the same run to be analyzed together. We validated the assay, and then we did a pilot study just to determine what were the prevalences in 5 different regions. And with that pilot study, then we estimated the actual number of samples that we will need to analyze to be able to have inference to the herd in the whole country. So here you can see the rock analysis for these assays, and you can see how sensitivity was, both sensitivity and specificity were very high. And what this assay does is a quantitative assay, but because you are not measuring titers, but it gives you a signal in fluorescence. So the highest the number of antibodies that you have there, the highest the fluorescence. So it works also quantitatively, and this will become important later on in the talk. So all of the assays that were developed have very high sensitivity and specificity. And with this, well, first you put different cutoffs, and you calculate the sensitivity and specificity in different cutoffs, and then you go with the best cutoff that will give you the highest sensitivity and that trade-off of sensitivity and specificity. So here you can see the cutoff points for each assay, and as I said, this will measure it's called mean fluorescent index. In this assay, it will measure, it will stop when it has measured between 50, well, you can set this up, 50 little beads. So each bead will give a quantitative value, and then it will make the mean of those 50 or 100 beads, and that's why it is called mean fluorescent index. So you establish the cutoff, and then with that cutoff, you go calculating the specificity and the sensitivity, and that's how you obtain those plots that I just showed you. And these are the optimal cutoff points for these assays, and then we tested those cutoff points, and here you can see how it can clearly distinguish between positive and negative samples. Then we did a selectivity assay, and what we did here is we added field virus to the reaction. And this field virus will inhibit the antibodies and will reduce the signal. This is, when you add the virus, instead of joining, the antibody will not join to the antigen in the assay, but will join the suspended virus, and then the signal should drop. So you can see here how this is the signal that we are obtaining, 100%, and we have a decrease in signal due to the virus that we have added to the assay. We also, these antigens were produced in baculovirus. So we wanted to check that the baculovirus itself was not reacting in the assay. So for that, we added another antigen of an influenza virus, H7N3, that is produced also in baculovirus. And that way, we could show that this inhibition is not due to the antibodies joining baculovirus, but it's actually specific for the antigens that we were testing. And then once you have them validated in monoplex, then you have to validate them in multiplex. Sometimes you can get cross-reactivity when you are working with several assays at the same time. And here you can see the performance of the study when we did monoplex and multiplex assays at the same time. Sorry. So the area under the curve that tells you how good it is, if you have a lower end under the curve of 0.5, that pretty much means your assay is useless. And the higher it is, the better your assay is performing. So once we have that, we divided the country in 5 regions by geographical areas that share some similar conditions. So all the states that are to the Gulf are rainforest and humids. Just to give you a bit of geography, the winds that cause the snowstorms in the east of the United States will come into the Gulf of Mexico as rain. So we have rain here in the summer and also during the winter time. In contrast, the Pacific coast is dry. Is dry tropics, and that's why they say in Acapulco they guarantee 360 days of sunshine, because it's dry tropics. The altiplane is territory that are over 1,800 meters high, and therefore has different climatic conditions. Then the north, that is mainly desertic area, and the Yucatan Peninsula, that you have experienced it, pretty hot. We estimated how many samples we needed to analyze, and this was over 2,600 samples. And as I said already, from herds that we know that the owner declared that they did not vaccinate, and we only collected from cows. So we know that these are animals that are old enough, and you might think, well, it might not be reflecting of what is actually happening in that moment. It could be reflecting what has happened in the last 6 months to a year. But anyway, that's what we were intending to do, just to have a benchmark prevalence for all these diseases. So we decided to go with cows. ¿Ese es el tiempo que queda o es lo que... Oh, didn't know that. Sorry, I have to rush a little bit. Anyway, so, sorry. These are all the farms. Those points are all the farms that, municipalities that we collected, and in each point there could be more than one farm. For bovine viral diarrhea, you can see that the prevalences are from 40 to 57%. So these are mesoendemic to hyperendemic. And you can see also each dot represent the prevalence shown for each municipality. For bovine infectious rhinotracheitis, a bit lower, but still mesoendemic, in the 30s. Leukosis, we were surprised. We were expecting much less for leukosis, but it is in the 50s. Parainfluenza, again from 40s to 50s. And the syncytial virus in the level of 50s. Then we tested by a logistic regression if some factors will affect the prevalence of these diseases. And those that are in bold letters are the ones that turn to be significant. And this was a surprise for us. This is just to show you in the map how varied the climates of the country are. You know, you have from wet tropics, similar to Florida. Then you have desertic areas, very arid and very hot. And so we analyzed a lot of factors by logistic regression, and we found that humidity, with decomposed climate, you know, is temperature and humidity. Temperature did not have an effect, but the humidity was significant and increased the risk ratio of prevalence for this disease. By contrast, arid areas, there was a significant decrease in the risk of seroprevalence. In terms of management, we found that breeding program also affected the prevalence of the disease. Continuous breeding, this is the bulls run with the cattle, the cows run with the bull throughout the year, increases the risk of seropositive, whereas seasonal breeding, but by the way, is only 3% of the farmers, decreases the seropositivity to these illnesses. We also did a spatial analysis, and I don't know if I have time. Yes, I do. Well, just to give you an idea how what we did with the spatial analysis, we didn't do the prevalence. What we took the actual value of, the actual signal for each sample, and we discarded all the negative samples. We only kept positive samples, and with that we did a spatial analysis. And you can see that you have samples that have a very strong signals, where you have other samples that have a much lower signal. ¿Puedes correr el video, por favor? ¿Tengo 20 minutos? I have 20 minutes left. That thing says 5 minutes, and I've been rushing. I'm almost finished. I will sing or dance. Anyway, sorry, there it goes. And so you can see where that you can have samples that are very, very high signal and other samples that are much lower signal. So with that, we put it into a model with what is called a Kriging analysis. And we obtain hot spots and cold spots. So for most of our diseases, we obtain around the north of Oaxaca and south of the state of Veracruz, hot spots for most diseases. We really don't know what this means, but the roads that come from the south, or well, that go from north to south, have to come through here, because this here is hilly area. So all the roads going to this part of the country, they come from this area. Whether that has something to do, we really cannot tell at the moment, but it is interesting that that area turned to be a hot spot. And around San Luis and west of Zacatecas, we got cold spots, again, for most diseases. Thank you very much, and I have like half an hour to answer your questions.
Someone have a question?
Hi, good morning, Dr. Mariana Colin from the UNAM. In the hotspots in the map that you showed, could they be related to rural areas of Mexico, and that's why there could be more hotspots in certain zones?
It certainly could. All of them are rural areas. All these are ranches, so they are all rural areas. But how wild west is that in terms of rural? I don't know. That area is high density of cattle. That area that's a Cayucan and that sort of is a very high density of cattle population. And again, that Kriging analysis is not percentage of animals infected or positive, is how high the signal is. So could it be an ongoing virus, at the moment that we collected the samples? That could be as well. Rather than having, the historic antibody titers, it could be reflecting something that is actually ongoing. We really don't know. But I think it's interesting.
Thank you very much. I'm Thomas Manske from Sweden. Fascinating data set. What will you do with it?
What can I do with it?
Yeah, what's the plan? What's your next step?
Right. Well, this sample data set, as I said, is 30,000 samples. At the moment, we are planning to go more in depth and see what's going on, and we are applying for a grant to update this, because this is already over 8 years old. So now nothing has been done since to improve this, so we don't expect it to be very different. If anything, is worse. But so that is actually reflecting what we will expect to have now. And as to what are we going to do with it? Well, we are applying for grants. We are developing further assays for other illnesses that we are interested on. Obviously, from that, what conclusions that you can take is we need to start having control programs. Only 30% of farmers vaccinate, for example. And when they say vaccinate, we don't know what they are vaccinating for. But most likely is rabies and Clostridium, not these diseases. So. Yeah.
So I must admit I'm very ignorant to Mexican agricultural industry, but would there be any interest from the farming industry to put on national control programs, for instance?
Well, everything is cost and benefit. I think we need to make them aware of the cost that they are incurring to and that they are not aware. And I think we need to do those economical studies that haven't been done. So we rely on data coming from Canada or the States or elsewhere, but they actually have to pay so they can actually take some action.
Thank you.
Thank you.
Hello, Nynne Bjørn from Denmark. I'm also not aware of how the cattle industry works in your country. I was wondering, how much are the animals moved? Are they closed herds, or is there a lot of moving around animals in these particular areas?
No, I don't have the token. Well, anyway, if you remember the map, I'll give you a bit of background. Once we came into NAFTA, the North American Free Trade Agreement, the way we produce beef changed. Before NAFTA, most animals will be fattened in pasture. After NAFTA, we get cheaper grain imports. So most of the animals nowadays, they are finalized in corrals. Yeah? And that means that now we have a lot of movement of yearlings and calves that are going to the fattening corrals. So yes, there are lots of movement. And all the north states have they are free of TB, brucella, and ticks, so they can export their calves. So many of those calves are exported to the United States. So yeah, there is a lot of movement, and that complicates the control.
Okay, thank you.
Thank you.
Great presentation. Miles Stewart from the United States. One of the questions I had for you was looking for those prevalences with, did it look like a herd or an individual was positive for only one of the viruses, or if they were positive for IBR, BBD, PI3? What were some of those co-positive prevalence look like?
We didn't went that deep in the individual samples, but when we did the study, Fernando is here, of the pool samples, at the farm level, yeah, we found that there are double positives, triple positives, but we didn't have like a pattern, and that we were interested to know, for example, with having the high levels of bovine viral diarrhea, that would predispose them to be more likely to have other diseases. The problem is that you're interpreting antibodies. So would you expect them to be higher or lower if they have bovine viral diarrhea? So it gets a bit more messy than just saying yes. But we have cattle that are positive to all the diseases. We actually struggled when we were doing the validation. We struggled to find negative for all diseases. But yeah, it's certainly something that is interesting looking at. Is quite hard. Thank you. We still have 15 minutes now.
Well, in order to have a many time, show up, we invite to watch a following video.
Prueba de California para el diagnóstico de mastitis subclínica. El objetivo de este video es mostrar la manera de realizar la prueba de California para diagnóstico de mastitis y en caso de obtener una prueba positiva, la correcta toma y envío de muestras de leche al laboratorio para la identificación de agentes bacterianos causantes de la enfermedad. El material que utilizaremos es el siguiente: guantes, toallas de papel desechables, cubeta con agua, jabón, reactivo de California, paleta para la prueba de California, torundas con antiséptico, que puede ser benzal, yodo, alcohol al 70% o clorexidina, frascos estériles con tapa de rosca, tazón de fondo oscuro, hielera y refrigerantes. Preparación del animal. Se debe realizar la prueba antes de iniciar la ordeña. La prueba se debe realizar de manera periódica para monitorear el estado de salud de la glándula mamaria por lo menos una vez al mes y dependiendo de la prevalencia de la enfermedad. En caso de no utilizar presello, se deberá utilizar torundas con el antiséptico. El tazón de fondo oscuro nos permite detectar alteraciones macroscópicas en la leche como coágulos, fibrina, tolondrones o cambio de color en la leche. Prueba de California. Para esta prueba se utiliza una bandeja plástica conocida como paleta, la cual consta de 4 pozos, los cuales representan a cada glándula mamaria del animal, en los que se depositan las muestras de leche en una cantidad tal que al girar la paleta hacia la posición casi vertical, quedarán de 2 a 3 mililitros de leche aproximadamente en cada pozo. Se utilizan de 2 a 3 mililitros del reactivo en cada pozo o una cantidad aproximadamente igual o ligeramente mayor a la de la leche en estudio. Después de homogenizar la mezcla del reactivo de California y la leche por aproximadamente de 7 a 10 segundos, se interpreta la prueba. Resultados e interpretación. Reacción negativa. No se observan cambios aparentes en consistencia y coloración de la mezcla. Reacción traza. Se observa un precipitado ligero en el fondo del pocillo de la paleta, con apariencia de una nube clara y discreta que tiende a desaparecer con los movimientos circulares. Reacción positivo 1. Se observa una mezcla espesa y viscosa, sin tendencia a formar un gel. Reacción positivo 2. A pocos segundos de homogenizar la mezcla, se identifica una masa gelatinosa, que al desplazarla por las paredes de la paleta se muestra espesa. Reacción positivo 3. La mezcla presenta una coloración fuerte tendiente al púrpura y se identifica la formación de un gel con superficie al exterior de aspecto convexo, mucoso y adherente. La prueba de California es una de las pruebas más utilizadas en campo para el diagnóstico de mastitis subclínica, la cual permite estimar de forma cualitativa la concentración de células somáticas. Toma y envío de muestras. En caso de detectar a un animal positivo a la prueba de California, se recomienda tomar una muestra de leche para su envío al laboratorio de diagnóstico bacteriológico, de acuerdo con el siguiente protocolo. Preparación aséptica del pezón en caso de no haber realizado la prueba de California. En primer lugar, se colectan aproximadamente 30 mililitros de leche en un frasco de plástico estéril con tapa de rosca. Debemos extremar precauciones para evitar la contaminación del borde del frasco y de la tapa. Una vez tomada la muestra, cerramos el frasco y se rotula con los datos del animal, el nombre del rancho, la fecha de colección de la muestra, la glándula de donde proviene la muestra y el diagnóstico presuntivo. Mantenemos la muestra en refrigeración a 4 grados centígrados. Es muy importante mencionar que si más de una glándula está afectada, debemos utilizar un frasco para cada una de ellas. Es decir, jamás debemos mezclar las leches de las glándulas. En caso de no poder llevar la muestra al laboratorio dentro de las primeras 24 horas después de su recolección, se debe congelar la muestra hasta su llegada al laboratorio de diagnóstico.
Well, we apologize for the inconvenience. The next talk is Cattle Health Programs, What Does Success Look Like? Presented by Liz Cresswel from United Kingdom.
Thank you very much. So I'm going to be talking about cattle health programs and what does success look like. And it was a question that I first started pondering when I was working as a vet in Australia. I was working on JBAS, which is the Yoni's Beef Assurance Scheme. And I had lots of farmers coming to me and they were asking me what their status was, and they were very concerned about what Yoni's level they were. But when I looked into their herds, I found that there were other diseases that were causing much more of a problem, so BVD, for example. And it made me wonder why we prioritize disease control in the way we do, and if there is a better way to do it. So I feel very fortunate that I was awarded a Nuffield Farming Scholarship to go and investigate this. And for those of you who aren't familiar with Nuffield, Nuffield is a charitable organisation that aims to bring positive change to agriculture. And they do this by awarding, in the UK, around 20 scholarships per year. There are Nuffield organisations in other countries as well. And the idea is that you are funded to undertake a training program which runs over 2 years, and you're funded to travel and explore a topic of your choice. So this was our 2022 cohort, and there's various farmers, vets, and other people involved in agriculture. So I wanted to understand what were these key ingredients for success when it comes to these cattle health programs. And so I travelled to Europe and to Southern Africa, to New Zealand, and to Brazil and to Texas. And so I was very fortunate to be able to interview over 50 different vets and farmers and stakeholders in the animal health industry to try and get to the bottom of some of these questions. So it's a much more qualitative approach to some of the other talks that we've seen, but I'm going to try and summarize in about 15 minutes 2 years worth of interviews and travels. So my first question was really, how do we define cattle health schemes? In the UK, we have multiple different voluntary schemes that farmers can get involved with to try and control either single-agent diseases or multifactorial diseases on their farms. And we have lots of different groups and people who are involved in the organisation of these schemes. And there is also some mandatory disease control as well, for diseases such as tuberculosis. But I realised that in other parts of the world, these sorts of schemes don't necessarily exist. And it made me realise that there are other ways in which vets and farmers are controlling diseases in the herds that are under their care in their other parts of the world. But actually there were some key similarities between the schemes and actually what these other people were doing in other parts of the world. So I want to try and summarise those. So what a lot of these health schemes do is to provide incentivization and support to get involved in diagnostics and trying to control diseases on farms. And one of the benefits of this is that these schemes can provide a commercial or a trade benefit and effectively a stamp of high herd health. But it got me thinking about, what does high herd health really mean? If you look at these animals on the screen, you can see that they seem happy and healthy, but we can't tell just by looking at them what their disease status is. But having said that, looking at them is a really important part of our assessment. And I had this concept challenge when I was visiting farms where, on paper, they were very high herd health status. And there was one farm in particular I went to where they were the highest tier of disease status that they could achieve in that country. But actually, when I went into their heifer shed, it was dark, they were being kept on slats, I could smell the ammonia, I could hear the cows coughing. And I thought, I don't really think that I can say that I feel these are a representation of high herd health. But they had the paperwork, and time again I would see this where assessors would come in and they would check the paperwork for these schemes, but they wouldn't actually look at the animals. And we have data and technology that we can now use to assess our animals. And I think we need to be using this, but also realize that there are other diseases that are not necessarily covered by some of these schemes. So in the UK, salmonella and Q fever would be examples. So if we're risking being blinkered by cattle health schemes if we're just stamping these herds as high herd health and not thinking about animal health and welfare as a whole. I was very fortunate to be able to visit Zimbabwe during my travels. And in Zimbabwe, there is a lack of national coordinated disease control programs. But that's led farmers and vets to take responsibility for the health and welfare of their own herds. And this farm that I visited, this pig farm that I visited in Zimbabwe, actually had the highest biosecurity standards of any farm I visited anywhere on my travels. And it was really great to see that they were really focusing on the basics. They got the basics right of genetics, of nutrition. They were looking at their stress reduction, and as well as their good biosecurity, they had a really comprehensive and tightly executed vaccination program. And it's been great to see over the last couple of days that these themes have been coming out. And it made me think, if these farmers can get it right without external support, do we even need these health schemes? But I think these health schemes do play a really important role, and I was reassured by my visit to Norway. So Norway have arguably been one of the most successful countries in the world when it comes to cattle health schemes, and that's helped them to eradicate diseases such as BVD and IBR, and even now things like ringworm. And I met Dag Lindheim, who is the leading vet for Tina SA, which is the Norwegian dairy processor, and he's been very involved in a lot of these health schemes. And he talked to me about this concept of cutting the tail. And what works for the first 80% doesn't necessarily work for the last 20%. And there are lots of different reasons that we might get to this last 20%, and we might be tempted to kind of take our foot off the pedal. It's where interest tends to wane, and it's often where the funding tends to wane as well. But actually, it's the really important part. It's a really important time for any disease control strategy. And he talked to me about the fact that what works for this last 20%, what has worked for the last 80% doesn't necessarily work for the last 20%. And so we need to take a different approach. And it's tempting to think that this is down to recalcitrant farmers and vets who don't want to engage with their industry. But actually, there are lots of different reasons that we might struggle to get on top of disease for this last 20%. There might be geographical, biological, socioeconomic reasons. So we need to be taking a different approach. And this is what's happening with salmonella control in Denmark. So Denmark have had a salmonella eradication strategy since 2002. And the prevalence of positive herds has dropped from around 25% to around 7%. But that figure is now rising again. And so what this team of scientists at SEGES, which is the Danish Research and Animal Health Innovation Organisation, what they're doing is conducting these farm visits. And they're visiting farms and trying to understand what the motivators and barriers are for these individual farmers for getting on top of these diseases. So they're taking this motivational interviewing approach, and they're finding that by really understanding the perspective of the farmer, they can get underneath the surface. And sometimes it just takes a few small changes and a fresh pair of eyes to make changes on these farms. But where they're engaging with the farmers and trying to understand where they're coming from, they're finding that they're getting more success on these farms. Something that I think we can probably all empathize with is the paperwork that comes with animal health. And this was coming up time and time again as a barrier to people participating in cattle health schemes. The paperwork and the regulatory burden that comes along with it. I think now we have so many different types of monitoring solutions where we can monitor our animals remotely when we're on our phones. We don't even need to be in the country. And we've got new technologies, we've got AI coming in, which is playing a big role in animal health. So we need to be considering how we integrate these into our cattle health schemes. And for anybody who is from Denmark or from the Netherlands or from Ireland, I was very envious when I traveled to your countries and saw the databases that you have, where every piece of information about these cows gets input, and it can really help to bring all this data together and provide transparency, which can really help with national disease control. So when we're thinking about implementing these cattle health schemes, we need to not just be thinking about the clinical aspects of disease control, but also about the usability and the implementability of these things. And I think one of the big issues that we do come across is these different systems that we have that all do their own jobs, but they need to be interoperable and actually reduce this regulatory burden that really is putting people off participating in improving the health of their animals. Ultimately, we will need some regulation if we really want to get diseases eradicated from individual countries, and even then it's not a guarantee of success. So how the health schemes tend to work is that they start with support and incentivization and voluntary actions. But if they're successful, then they can provide leverage to implement compulsory eradication actions. And this is what we've seen with BVD, for example, in several countries, and it's what we're seeing with BVD in the UK at the moment. But then once a disease is under control, it doesn't mean that the scheme necessarily stops. So we might have cut the tail of an outbreak, but we still need surveillance and monitoring to ensure that the situation stays under control. And so I visited the World Organization for Animal Health headquarters in Paris, and it's them that provide this estimate that globally 20% of livestock protein is lost due to preventable disease. And they recognize the fact that the challenges involved in implementing health schemes at a global level are enormous. There are political, social, and economic issues, and they recognize this and they provide frameworks. And the frameworks identify aims and milestones and responsibilities that need to be achieved. But they implement their own individual member countries to decide on their own strategies. They empower them to decide their own strategies to achieve the aims of these schemes. So at the end of your scholarship, you're asked to provide a series of recommendations. My report is now published and on the Nuffield Farming website. But for the purposes of today, I've tried to distill it down into three main categories. And so for governments and regulatory bodies, I think that framework is really important to provide a strategy that everybody is working towards. And so if we're identifying these aims and milestones and responsibilities, we're much more likely to be successful. but we need to understand that we need to take a flexible approach and be adaptable, not just for individual members, but also over time as well. For industry, and I would include vets in this, as well as other agricultural organisations and consultants, thinking about what the bigger picture is. What are those non-animal health factors that influence animal health, and seeking win-win solutions that streamline the process for everybody. And for farmers, good basics. We've talked about the fact that these health schemes provide incentivization and support for improving animal health, and they also provide trade benefits, so they can improve the health of your herd, but also the health of your business. But none of this can be achieved in isolation, and we need to be communicating between the different organisations, and this can really be facilitated where there are strong partnerships in place. So, at the end of the day, these cattle health programs are very complex, they're very multifactorial, and there are lots of different challenges and opportunities for implementing them. They provide an opportunity to improve animal health and welfare, and they also provide an opportunity to improve the trade and commercial opportunities. And there are some key underlying ingredients that can help us to achieve success in these. So I'm very grateful to Nuffield Farming and to my generous sponsors, the Central Region Farmers Trust, as well as my colleagues and friends and family who've supported me on the journey of this scholarship. Thank you.
Someone has a question for the doctor?
Thank you.
Okay, the next talk is calf health and disease in Danish dairy herds practicing cow-calf contact by Christine Dahl Petersen from University of Copenhagen, Denmark.
Yes, thank you. I know it says Mette Bisgaard in the program, that's my colleague, and if somebody came just to see Mette, you'll find her in row 2. But I'll be giving the talk about calf health and disease in Danish dairy herds practicing cow-calf contact. And I'll just show you some preliminary results because we are not finished with the data analysis yet, but I'll show you what we found so far. And just to tell you where we are in Denmark. That's pretty far away from where we are now. That's 9,000 kilometers away. And it's a tiny country in the northern part of Europe. We have high-yielding intensive dairy production, about 2,500 herds. The average size is about 250 cows, so we don't have these mega dairies. And about 15% of the farms are organic. Most of the farms have Holstein, but we also have Jersey and Danish Red. And the calves are separated from the cows shortly after calving. It's stated in the law that they should stay together for at least 12 hours. And the organic farms have their own industry agreement that they should stay together for at least 24 hours. But after that, they'll be separated. So we wanted to look into this cow-calf contact concept. And what is that? Well, basically, it's systems where calves are housed together with either their own mother cow or with a foster cow for a prolonged time period and are allowed to suckle during that time period. However, that's just like the frame around it, because it's not just one system that fits all. It's actually very many different systems, and there are many ways of doing this. So it can either be with a mother cow or with a foster cow that will then take care of 2, 3, or 4 calves. You can keep them together both night and day, or just during the night or during the day, or you can wean them after a month or 2 months or 3 months, or so many different ways of doing it. And I think it's fair to say that every time we've spoken to 2 farmers about this, they have described 5 or 6 different ways of doing it, because it's new to the farmers as well, and they are adjusting along the way. So it's not just one system, it's more like a way of thinking. So here's a picture from a Danish farm where they have this cow-calf contact system. And it's not very many farms in Denmark that practice it. As I said, we have 2,500 dairy herds in Denmark, and I think on a good day you can maybe find 25 herds that are committed to practicing cow-calf contact systems. But we wanted to look into this because I don't know how it is here in Mexico, but at least where we're from, there's a rising consumer awareness about animal welfare issues in the dairy industry. And some of the farmers mentioned that was actually their motivation for going into this, because they wanted to be proactive and prepare for the future, because they expect that in the near future, consumers will be more and more aware of how calves are reared in the dairy industry. Another thing that the farmer mentioned was that it's a way more satisfying way of work. They don't work less, not at all, but they spend their time on different things. Instead of spending a lot of time on washing milk buckets and drinking nibbles, they observe the animals. They have to stand and look and see if that foster cow is a good match with these 3 calves, and make sure that they bond well. And they have to spend a lot of time doing that, and they actually feel that's actually quite a nice work, and they enjoy that very much. So that was very important for most of the farmers as well. We don't know very much about the health and disease effects from these systems. A lot of research, no, not a lot, but some research has gone into exploring the behavioral aspects of it in terms of emotions and welfare, but not very many studies has looked into to health and disease. So we wanted to do that because there's actually a real lack of knowledge here. Is it beneficial for the calves and the cows or not? And we wanted to look into that. So we did this small research project, and as I said, not very many farms to choose from, maybe 25 in total. So we chose 5 of these dairy herds, and they were all organic. The herd size varied between 70 and 600 cows. And the farmers had between 1 and 5 years of experience with these cow-calf contact systems. 9 of the herds used foster cows, and only 1 had a system where the mother cow stayed together with the calf. The farmers all told us that initially they wanted to have systems where the mother cow and the calf were together, but for logistic reasons, that's just not a viable solution in the farms. So they all turned to foster systems instead. And the foster cows are primarily cull cows that instead of going directly to slaughter, then takes care of these calves for 2 or 3 months, and then they go to slaughter, preferably with a bit more flesh on their bones. So, we only included the heifer calves in our study, and that's because it varies a lot what the farms do with the bull calves. So we just included the heifer calves. And we looked at the first 4 months of their life. And well, I'm glad the previous speaker, Dr. Cresswel, mentioned the cattle, the Danish cattle database, and was envious of that. And yes, that is a gold mine of information for a researcher. All sorts of information goes into it. And the information belongs to the farmer, but as a researcher, we can gain access by request. So we based our study on disease and mortality numbers from the Danish cattle database. And because, as I just described, there are so many different ways of doing this, it didn't make any sense to compare the farms to each other or across. So each herd is compared to itself. So we've looked at a time period before they changed to the cow-calf contact system, and then at a similar time period after they have changed, and then compared the farm to itself. And so we have some numbers here, and you can see for most of the farms, we've been able to compare a 2-year time period before and after the switch, but farms C and D had not been practicing that system for so long, so that the time periods here are shorter. And again, you shouldn't read top to bottom, because it doesn't make sense to compare the farms to each other. You should read from one side to the other and see what happens with the one farm. And we were a bit disappointed when we first saw these numbers, because we were, of course, hoping for some kind of clear tendency, and we don't see that at all. For some, the disease percentage goes up. For other farms, it's more or less the same. And for some, there's a dramatic decrease. And we're not really sure why. And that's some of the things we have to dig into. But for now, we're not sure why it's like this. And when we look at the numbers for mortality, we can see the same here. And by the same, I mean results pointing in all directions. So again, some will have more or higher mortality rate. Some will have more or less the same. And for some, it's going down. And we're not sure why. And we were like, oh, no, we hoped it would be such a good story to tell that everything goes down. It's so much more better. But we can't really tell that yet anyway. We've discussed it a lot in the group, how we could explain this, and we think at least some of the explanation is it's very much a matter of management. And if you don't have a good system running before you transfer into the cow-calf contact system, then it won't work for you. What we do see is when we pool the data, that there is a difference between the conventional rearing and the cow-calf contact in terms of when the calves do get sick. You can see in the conventional rearing, they get sick almost from the beginning. From day 0, they become sick, and then they have this period of the first week or 10, 12 days and where we can see a lot of disease. After switching to cow-calf contact, we can see there's a shift. And the first 5 days or so, there's almost no disease. And probably that's because the cows, the calves are with the cows and they get to drink all the colostrum and all the transitional milk they want. And also the farmers are very, very attentive during these first days to make sure that calf and cows bond really well. And then when they're moved to a larger pen, maybe the farmers aren't as attentive or something happens anyway. We can see that there's a shift, so instead of becoming really ill in the beginning, the first 5 days or so, it shifts, so it's more like 5 to 15 days we see this rise in disease. We had a master student who did a small project in 4 of the 10 herds. She went out and examined calves, and did an evaluation of the immunization status. And what we can see here is that the calves are really, really well immunized. Almost 64% are in the excellent category. And this is actually quite interesting because we know from prior Danish research that in the conventional herds, the picture is almost the opposite, that the majority of the calves would be in the poor category. So, so far so good, but still we see it's not that it takes away all the disease. There's still disease, but initially anyway, they are very well immunized. There are, of course, some limitations to this study. First of all, it's a small data set. It's very few herds, and they're doing things differently. And some of them are also changing the system as we go along, so they don't do the same this week as they did the week before. It's based on the numbers from the database, and the quality of the data you get out from the database is, of course, dependent on the data that goes in. And then there is this a rather short transition period. We looked at the farms rather shortly after they changed to the cow-calf contact systems, and they are still learning how to do things and they're still adjusting. So maybe if we came back in 5 years or so and looked at the same numbers, they would be different. Perhaps, we don't know. And then, of course, there are many unknown risk factors. There are management and changes in staff or feeding strategies. Many things can affect this. What we do conclude is that the calf seems to have very good immunization, but there are still challenges with disease and mortality, and we especially see that between day 5 and 15. And we speculate that the early detection of disease in calves could be more difficult in these calf contact systems because the farmer doesn't look the calf in the eyes 2 or 3 times a day when they feed them milk. The cow is taking care of that, so it's perhaps more difficult to discover the sick calves. A little furry ball curled up in the straw, is that a happy and full calf sleeping, or is it a sick calf? That can be difficult to tell. Yes, and this project was funded by the Danish Milk Levy Foundation. And here's a nice picture of a Danish cow tending 4 calves. And do you have any questions?
Someone has a question for the doctor?
Congratulations on a good talk. Did you also take into account the disease of the cows, for instance, mastitis? Or
Could you
other-
speak into the
Oh, yeah, sorry. Did you also take into account the disease of the cows, for instance, mastitis? Is that...
No, not in this part of the project. We'll be looking into that in the fall. But we couldn't do that at the same time. But it's absolutely relevant to look into the health status of the cows, absolutely.
Okay, thank you. And can I ask another question? You told us out of 10 farms, 9 do the foster system, but I've also heard that consumers really prefer the calves to stay with their own mothers. So is that something that you foresee in the future as well? Or do you think the foster system will have enough consumer backup?
I don't know, but I know that you're absolutely true. The consumers prefer mother and child to stay together.
Exactly.
Yeah. As of now, it doesn't seem to be a solution that the farmers can really work with. It's just not doable. So I don't know. I don't know if consumers will be satisfied with this kind of half solution.
Yeah.
I know there's a study from North America that said that the consumers found that was not a good option.
Yeah.
They want the full package.
Yeah.
So I don't know, but for now, it's the best the farmers can do, I think, unless they rebuild their barns.
Yes, exactly.
Because it's a matter of logistics.
Yeah.
Yeah.
Okay, thank you.
You're welcome.
Thank you for the presentation. The item is a big issue in Germany too. And in the online media, the dairy keepers are discussing the item of the milk amount intake, because it's not alone on the bricks and the protein, it's the amount taking in. And I didn't understand it. You told us it's a colostrum intake and then the foster. So there's a switch from the own mother to the foster cows. This is taken at which point in the disease line?
Yeah, and I can't give you a simple answer to that because they do it in different ways. Most of them let them stay together with their own mother for 2 or 3 or maybe 5 days, and one farm even had them with their own mother for 3 weeks before switching to a foster cow. So I can't exactly tell you how that influenced these numbers because, yeah, they're doing it in so many different ways. But it's a good point.
Thank you, super interesting. From the database, I know that the farms were compared to themselves before and after, but from the database, can you compare to dairies not practicing this technique?
Yes.
You know, what would you compare mortality and morbidity in those?
Yeah, we could that. To get the data, you have to request for specific farms, so they have to agree that you extract their data, and we haven't done that in this study. But of course, that would be relevant to do that. Yeah.
Hi, thank you very much. It was a very interesting presentation. I wanted to ask, do the farmers somehow test the milk quality of the cows? Because I understand the fosters are mostly cows. So perhaps they have some kind of, other infections also, which might contribute also to the higher mortality and disease from 5 days or so on.
So the question was, do they
test the milk
colostrum?
quality? No, the milk quality of the foster cows, I mean.
No, they don't. No, they just make sure that the foster cow has enough milk. So by rule of thumb, that's 10 liters per calf per day.
Okay.
Yeah, but they don't test the quality, not to my knowledge, though.
Good morning. How many calves per nurse cow have you seen be successful? What kind of guidelines would you have for that? Or is it just dependent upon the milk production of the mom? But, yeah.
A foster cow usually takes care of 3 or 4 calves.
2 or 3? Okay.
Yeah. And that works well. And when they are transferred to the bigger pens, where there are more cows and more calves, then The cow is still aware of where her calves are, but the calves are not. They don't care which cow they suckle on as long as there's milk, they're happy. Thank you so much.
Well, the next talk is identify risk factor and factor blocks for calf mortality in large commercial dairy herds using multiblock analysis, presented by Dagni-Alice Viidu from Estonia.
Okay, Okay, great. So good morning, everybody. Without further introduction, I'll just get to it because I have a lot of things to say and I hope we'll stay on time. So, mortality in calves. If I would ask you to name a few mortality risk factors, I'm pretty sure that we would come up with quite a lot of different ones because it's just such a multifactorial problem. And in addition to having a lot of single risk factors, probably you can all come up with some topic areas or management areas which might affect calf mortality more. But now if a farmer would ask for our advice, whether we're practitioners or scientists or advisors, if a farmer would ask our advice on what really affects calf mortality the most, it would be quite a difficult thing to answer. We might want to start categorizing the things we know into those blocks or thematic areas. But even if we do it and we come up with those nice lists, we know that some of those lists or areas might have more important things, some might have less. So it still doesn't let us answer the farmer's question about what exactly influences calf mortality the most. So the farmer really wants to know what specific factors they should focus on, and if there are specific factors or maybe there are those areas, not factors. So it's it's kind of a big mess, if you can see, because calf mortality is not an easy thing to conquer. So let's go back to the beginning. Why we even talk about calf mortality? As we all know, it's a key indicator of calf health and welfare in the farms. But it's quite a multifactorial issue. It's hard to tackle. And previous studies have mostly focused on identifying the individual risk factors, or they might have focused on one or two management areas. But we kind of lack the information on which areas to prioritize, what to advise the farmers, what to prioritize on. So what we aimed with our research was to investigate first just a wider range of possible herd level calf mortality risk factors, but also to demonstrate what management areas or which of those thematic blocks influence calf mortality the most during the pre-weaning period. And I have a little overview of what we did. But it will be very brief. So we collected data from 118 Estonian dairy herds with at least 100 cows and the loose house system for the milking cows. So we wanted to exclude those small family farms which might have also tie stall keeping and so on. And we visited each farm, filled a questionnaire about the predominant keeping practices during the last year. We also gathered different samples like pork tank milk, heifer's blood samples, calf blood samples, calf fecal samples. Did a lot of tests from those samples. We also did on-farm scorings and measurements, so we gathered a lot of data. And in total, our final data set included 148 questions, which we then divided into those thematic blocks. based on discussions with herd health vets, our co-workers at the university, and so on. So we composed those 13 clinical blocks. And a very quick overview of Estonian dairy sector. As you saw in the previous presentation, Danish dairy sector is quite intensive. Estonian is quite the same. Most of our cows are housed in those very large herds. Our average herd size is, nationwide average is 78, but at the same time, over 90% of our cows are kept in those large herds with over 100 cows. And they are very high yielding. For the past few years, Estonia has been on the top of the average milk yield in Europe. And currently in 2023, our nationwide average was 12,000 kilograms per cow. And for our research, we gathered also calf mortality data from the farms and from the National Registry. We used it in 2 separate time periods because of where we got the data from. So we had mortality risk for calves up to 21 days old, which I will refer to the younger age group, and also how we had the older age group, which was calves 22 to 90 days old. And first of all, what we did was we looked how each of those 148 variables were associated with either of the 2 mortality risks. And then we had this multiblock analysis, which is the interesting part, which tells us how each of those management areas influences calf losses, and also how each variable and each category of each variable influences them. And it really helps us to kind of rank the thematic blocks and tell the farmers better what to prioritize. And you don't have to read anything from here at all. This is just for illustration of how it works. So we had a number of blocks, 13 as I said. Each of those blocks had a variable number of variables from 2 to 7, and each of those blocks kind of had like a set amount of effect, so to say. And we calculated this effect for each of the blocks, and then we combined the effects into what we call global component. So basically, this tells us how much of all the calf losses are explained by all this data that we gathered in the blocks. But also it allows us to prioritize and like rank those blocks according to how big proportion of the calf losses they explain. So it will get easier within the next few slides. But also what I wanted to note out was that we could also look at the whole pre-weaning period like, as a whole, and we could also look how those variables affect the mortality rate in the younger age group separately and how they affect mortality rate in the older age group. So we do get a lot of information from that model. And I will start just with the most interesting part, those thematic areas. So here you see the management areas, the thematic blocks as we call them. And in that circle here is the block importance index, which represents how big proportion of this total effect is explained by this respective block. So what we see is that on top of the list, the most significant blocks are routine stress-inducing activities, general herd characteristics, calving management, housing, colostrum management, and so on. But of course, this block importance index isn't this only thing we look when we would like to rank our blocks. It's the most important thing, but there are some small nuances we can also take into account. But even if we would take them into account, you would still see that there are some changes in the order in the top, some changes in the middle, and some changes in the bottom, but actually the big picture stays the same. So that just makes us more confident that those 4 blocks are the ones we should focus on, because they whatever way we try to rank them, they still stay on the top. Oh, I'm sorry, fifth one also stay here, it should be 4. So what we can see is that most influential management areas related to the whole pre-weaning period mortality are related to internal and external biosecurity practices and hygiene and stress. And when we go on to the results of each block, then you will see where this conclusion comes from, because each of those blocks included very different questions, and categorizing them into blocks was quite a difficult task on its own. We'll go over what was important in each of the blocks. And I have included a small legend here on top, so it will be easier to follow. We'll use this abbreviation MR21 for the mortality risk during the first 21 days, and MR90 for the mortality risk during the 22 to 90 days of age. And things that were found to be risk factors are shown with a red upwards arrow, so it means that they were associated with increased mortality, and things that were determined to be protective means that they were associated with lower mortality. So when we look at the farm characteristics block, in the brackets, you also see that variance in this block in Portex index, what you saw in the previous slide. Basically, it's just a reminder of how important this block was in total. And just saying that because we have a bit of time constraints, I will only go over the individual risk factors from the blocks that were important, because as you saw in the previous slide, I only had 9 blocks in there, but in total we had 13, but not all blocks were significantly associated with mortality, so I will just focus on the most important things. So, keeping calves in quite old barns was a risk factor for the younger age group mortality, while keeping them in barns 10 to 20 years of age was associated with lower mortality in the same age group. And quite an interesting finding from this block was that higher milk yield was associated with lower mortality of the older calves, even though previous research mostly has detected milk yield to be a risk factor, but we saw that it's a protective factor for mortality. And also forced ventilation in calves' rooms was associated with lower mortality, which was kind of logical finding, because during that time period of 22 to 90 days, respiratory diseases are the most common problem for calves, so it's quite logical that we saw this one. And then from the calving and colostrum management block, seeing the calf suckling the first colostrum was a risk factor for mortality rate, probably due to the very low prevalence of the practice of testing the quality. So most probably the calves didn't get quite good enough quality colostrum. Please, 1 second. And also housing sick or soon to be calved cold cows in the calving pens was a risk factor for the calf mortality. I'm very sorry. Again, what this speaks about is the hygiene, the importance of good hygiene in the calving pens, because the sick or cow animals might very well harbor all kinds of different pathogens that might transmit to calves and therefore increase the mortality in calves. And the single most important risk factor we detected in our analysis was having dirty udder area in more than 10% of cows in the calving group. And most likely, the udder area is something that speaks more about the current hygienic situation in the environment rather compared to, for example, the flank area, which takes a lot of time to clean if it's already contaminated with manure. So I think this dirty udder area is very clear sign of the hygienic criteria or like hygienic situation in the calving group, and it was associated significantly with higher mortality rate in the older calf age group, and also with the combined calf losses, meaning that, as I explained in that illustration, we could look at either of the two age group mortalities separately, but also we can combine them into this whole pre-weaning period calf losses. And this sterile area was also associated with this, meaning that it was one of the most influential variables that we detected. And some protective factors regarding calving and colostrum management was longer colostrum feeding duration. Of course, it enhances the immunity of the calves. As also you saw in the previous slide, that calves that get colostrum for more time, usually they have better immunological state. And also using esophageal tube for feeding the first colostrum in cases where the calf doesn't drink on its own. Again, it's just something that helps us to ensure that each calf gets, good normal amount of colostrum. And also always measuring the colostrum quality. So basically what this end here tells us is that, again, the good immunological status of the calves, ensuring that is really important, and not just for the mortality during the first 3 weeks, but also it has an effect on the, subsequent age period. And then for housing and feeding, there are different age periods here, first 4 days, first 3 weeks, and feeding during the first 3 weeks. Washing the newborn calf box before you place new calf in there was associated with lower mortality in both age groups. Again, quite a logical finding. Better hygienic situation, less pathogen transmission, and so on, entails lower mortality. And for the first 3 weeks, housing calves in larger group pens was the most, I haven't written the effects like in number into here because it would just be too much information, but most important from these was keeping calves in large group pens. And I remind you that this is the first 3 weeks. So having large group pens during the first 3 weeks increases the mortality in the older age group, meaning that again we have this like long-term effect of some of the things. Possibility to defecate into another pen enhances pathogen transmission and was associated with higher mortality. And access to an outdoor area was kind of interesting finding, but we only had 6 farms. Oh, sorry, we only had 6 farms that did this, so I wouldn't focus on that this much. And then feeding using an open bucket was associated with higher mortality, possibly due to the kind of location where they are fed, because most of the farms that had this open bucket, they were just placed basically on the floor, meaning that the calf had to really crouch down to eat. Using an automatic milk feeder, and again I remind you that this is during the first 3 weeks, so early introduction into automatic milk feeder system was associated with higher mortality, but here for the sake of making the analysis, we had to combine the farms that used this for the whole period, or also for just part of the period, or only for some animal groups, so even farms that only used automatic milk feeder for, let's say, bull calves, they also were included into this. And also feeding waste milk. Feeding waste milk. Oh, I have only 2 minutes left. Yes, I will quickly go over this too. So from general disease prevention measures, housing sick or soon to be called cows in calving pens, again, disease transmission would be more efficient probably, and entailed increased mortality, while using wet disinfection in the newborn calf boxes was associated with lower mortality. And then this routine stress-inducing activities, it was based on the block importance. It was one of the most influential blocks. However, the variables that stayed in this block for this analysis were were related to disbudding mainly. So disbudding all calves versus only heifer calves, and disbudding at an older age were both risk factors for young age group mortality. And from the external biosecurity block, grazing youngstock, quite an interesting finding, was associated with lower mortality in the older age group. This is something we can't quite explain, to be honest, because the base category was no grazing, so compared to no grazing, grazing youngstock is protective. And visitors always wearing protective attire when they come into contact with calves. Also, it had lower mortality in the older age group. So basically what we conclude from all of this is that calf mortality is quite a multifactorial problem. There are a lot of layers, a lot of things you have to take into account when you want to advise farmers or anybody actually about calf mortality. But what we did find from our study, or what we saw should be the focus, is minimizing transmission of infections, while of course also enhancing the immunity of the animal. But transmission of infections was just something that came up from all of those important blocks. So this is what we should focus on to tackle calf mortality. Thank you very much, and I will be happy to take any questions you might have, and I hope you got something interesting to take home from this.
Congratulations for your communication. Maybe you explaining that I don't understand, because I want to know what is the explanation that the higher meal yield,
Sorry?
higher meal yield, higher meal production in the farm, decrease the mortality.
Yeah.
Thank you.
What I think might be that because we excluded all the very small farms and we only had those large commercial farms in our study, who also have quite a high milk production, probably to achieve this high production, they must have set routines and very thought through and planned production. And this might mean that also everything associated with calf rearing also is pre-planned and they have certain set routines. So I think it might be due to that our farms were quite similar to each other and had a lot of set routines that help to ensure that everything is done according to what they should be. But just my explanation.
Anyway, then it's not direct relationship.
Yeah, no, definitely not a direct
exactly.
association, yeah.
Thank you.
Thank you so much for a really interesting presentation. I'm wondering if next steps, if you're going to take producer perceptions into account in ranking these things and sort of how easy it is to implement certain practices. Is that sort of on the horizon with this work?
To be honest, I have a lot of thoughts about the farmers' minds and perceptions and how to incorporate this. We have actually done 2 studies within the same project that investigate farmer attitudes and calf care workers' attitudes and personality and all those things, how those are linked to calf mortality. But at the moment, we haven't put them together into one pile. But very broadly to conclude, we also saw that yes, farm managers and calf care workers, their attitude also and what they prioritize, this affects calf mortality. So most likely we would see that there's an effect on their opinion also.
Thank you for your presentation. It's really good. I was wondering if you think in the future, or maybe if you do like an in situ analysis in every farm, you can kind of generate a protocol of what you think are the most interesting questions to ask to those questionnaires, and do like an analysis in the particular farms and be able to analyze like the specific aspects in every farm that are causing or increasing mortality in particular, because I think the information you generated is really good. might explain generalities, but if you applied it as in a form of protocol or something like that, maybe you can tackle mortality differently in farms? I don't know.
I guess if I would want to do something like this, I would probably use what we saw here and make like a kind of a checklist for each of the farms. But in practice, I would basically use what we found here and see if each of the farms where we do the assessment, if their situation, is like what it should be, and then go on from there and see if the changes that they should do are they realistic for this specific farm. Because some things, we can say as scientists that you should this or this or this, but in the end it has to be the farmer who does those things. So it definitely also has to do with farmers' motivation, because some farmers just, even if they have all the information about the best practices, they still don't implement them on their farms. So I guess it's more of a work with the farmer and convincing them rather than just getting things done.
Thank you so much.
Thank you.
I could build a spaceship for you, but it wouldn't get us anywhere tonight. And you can start a revolution, but we both know it will never end. It won't end this stupid fight. I just wanna laugh with you, burn our ships and start anew. Don't you wanna try? Spaceship for you, if you really feel you need to fly away. You would have a hell of a view, never ever see a cloudy day, but I'm asking you to stay. I just wanna laugh with you, burn our ships and start anew. Maybe if we try. I will build a spaceship for you that will take you right up to the stars tonight. It will be a spaceship for two. If you're gonna make it to the moon, I'll be right there by your side. I just wanna laugh with you, leave the world and start anew. We just gotta try. Spaceship for you. And you can start a revolution. after all, I'll pick you up when you are down and about to fall. Life might seem wrong, but this won't be lasting for too long. Gotta be strong and have trust in all these dreams that you've been praying for. Shine out for you. I will never turn my back on our truth. On days of doubt, I will listen to you as a friend. Hope let you down, but we'll take the future in our hands and walk again. Take a loving heart, 'cause I know there's nothing here. Nowhere to dance under the shooting stars, 'cause we know there's nothing here. Remember the times when we went all the way. We never went home, wanted the crowd to stay. If there's somewhere to go to take a loving heart, let me know, I'll be right there. Can we go back? 94, go straight back to 94 when we all hung out. No, we didn't mind. Wanna go back to 94, go straight back to 94 when we went all out. All the time flew by. Oh, if we take back the night, we don't have a care in the world. If we go back to 94, go straight back to 94, then we go all out. Then we go all out. Still in my memory like a photograph, and I know that all how the time flew by. Oh, if we take back the night, we don't have a care in the world. If we go back to 94, go straight back to 94, then we go all out. Then we go all out. Then we go all out.
I was thinking about the day we met, and the love came rushing out, and you were empty-handed, filled with regret. I was thinking about the day we met, when the love came rushing out, and you were empty-handed, filled with regret. Our love is running out. Our love is running. Our love is running. Our love is running out. Our love is running, running, running out.
Well, good morning. Our next keynote speaker is Dr. Ricarda Jahne with Phenotypical for Dairy Cattle Resilience using Genetics and Genomics to improve livestock sustainability. Dr. Ricarda Elizabeth Jahne, she is a quantitative geneticist in the Center for Improvement of Livestock at the University of Guelph in Canada. She's maintained in close contact and worked with dairy and beef industry leaders. With her background in both industry and research, Ricarda obtained a strong insight of the market of agricultural sector. She's obtained her master's degree in animal science at the University of Rostock and her PhD in quantitative genetics at the Research Institute for Farm Animal Biology and the University of Kiel in Germany. She's developed statistical methods for important livestock traits, including indicators, traits for greenhouse gas emissions, and the epigenetic phenomena, parent of origin effects for genetic evaluations, and found research solutions to industry partners. Thank you so much.
Thank you so much for the introduction, and thank you so much for the invitation today. It is an honor to speak to you today. I'm not a veterinarian, I'm a geneticist, and I'm, in my heart, always identify as a farmer. But what I've seen in the past of working together or working in different fields, on farm, in the industry, or now at the University of Guelph in research, is that I love to work close together with the veterinarians. And by working close together, we can be unstoppable and we can create beautiful things, which I will show you today, where we phenotype for dairy cattle resilience. I will show you that through the Resilient Dairy Genome Project, where we defined resilience as the capacity of an animal to adapt rapidly to changing environmental conditions without compromising the productivity, health, or fertility, while becoming more resource efficient and reducing its environmental burden. The Resilient Dairy Genome Project started in 2018, and it's a large-scale international collaboration funded with nearly $13 million. This is just one project in a time series of multiple projects building environmental traits capacity over time. Starting back in 2012, where at the University of Guelph, we stored milk spectral data and used it. The Efficient Dairy Genome Project started in 2014, where we for the first time phenotyped for methane emissions and feed efficiency. And now the Resilient Dairy Genome Project helped to propel new projects, like the regional initiatives, where we are installing sniffers on a large scale in commercial farms, and the newly Net Zero Dairy Genome Project, an international challenge team where we're trying to build roadmaps for greenhouse gas emission to obtain the very ambitious goal of, in Canada, to have a net zero by 2015 in the dairy sector. This project is led by well-known international leaders of academia and the industry, where we're having the geneticists
Christine Bayes, Flavio Schenkel, and Filippo Miglior as our industry partner. But we're working close together with the veterinarians. Here you can see Ronaldo Seri from the University of British Columbia and Marc-André Zirat from the University of Laval. These people came together and integrated the Resilient Dairy Genome Project, where we're integrating genetic and genomic approaches to enhance resilience, improve feed efficiency, and reduce greenhouse gas emissions in Canadian dairy cattle. We're looking at our proposal as an engine, where the fuel are the newly phenotypes, where we're looking at closer to biology fertility, led by Ronaldo Seri, enhanced disease resistance, and environmental efficiency, led by Christine Bayes. The engine, the powerful engine we're creating, include the genomic and environmental relationships between the new phenotypes and well-established traits, as well as multi-generational effects and epigenetic effects, the latter led by Flavio Schenkel and the other led by Marc-André Zirat. To ensure the working of this engine, we need efficient and precise data management, led by Paul Stoddard. The oil of these engines is the GELS part. GELS stands for Genomics and Ethical, Environmental, Economic, Legal, and Social Aspects, which will help optimize traits for maximizing sustainability and social acceptance. With this powerful and well-functioning engine, we can ensure rapid and meaningful change in translation and implementation. And we can this ultimately leads us to our goal of developing genomic tools to select for sustainable cows. Our national and international collaborators here are spread throughout the world. In Canada, we have the universities of our industry leaders help to phenotype for the novel traits. The project is greatly funded by Genome Canada, Genome Quebec, Ontario Genomics, Genome Alberta, and Genome British Columbia, as well as regional ministries. In the US, we're partnered up with the universities of Iowa State, Michigan State, University of Florida, and University of Wisconsin, as well as the CDBC, USDA, and FFAR. In Europe, our partners came from Denmark, Germany, France, Switzerland, and Spain, as well as our partners in Australia. All these incredible researchers, industry leaders came together and phenotyped for resilience. And the number of cows in our database up to now are nearly 20,000, where we are genotyped more than 18,000 cows. But what's really impressive are the phenotypes. Looking at DMI, dry matter intake, we now have more than 1.5 million observations. These novel traits are in closer to biology fertility, estrus behavior traits, anogenital distance and size position score. But we're looking also at enhanced disease resistance, for example, fertility disorders, bovine spastic syndrome, calf health, leukosis, and Johne's disease. And in our environmental efficiency, we're looking at methane emissions, feed efficiency, heat tolerance, and body maintenance score requirements. This can only be done by phenomenal people over the time. This project has right now 27 peer-reviewed publications, and we did a little bit of a calculation over the thumb, and there are nearly as many papers still in the pipeline. I am so lucky to mentor right now 6 of our graduate students, seeing here, no, 5 actually, because Lucas Lopez successfully defended his PhD thesis a few weeks ago. And these guys are fantastic. I have no idea how to mentor or supervise, because 90% of my job, I'm just telling them how fantastic they are. Avalon, our new member, Avalon Phillips, she's a master student, just started, and she already wrote her first proposal and got a scholarship of $15,000 directly, which is fantastic. But I'm mumbling around. I'm so proud of them. I want to show you today, not the peer-reviewed publications you can read up. I want to show you the hot stuff, the one where the results just came out of the Linux engine. And first I want to show you the work of our PhD candidate, Gabriela Dott. She is looking at anogenital distance. Anogenital distance has the potential to be an easy to measure trait which we can really, really easily implement into breeding programs. Through studies done in the past, it showed that shorter anogenital distance has favorable correlations with positive reproductive outcomes. Also, I know how busy you veterinarians are and how much time you have to have for other things. With this trait, veterinarians can actually train a technician to phenotype for anogenital distance. If we would implement this trait into the breeding scheme, it has high moderate heritability, so there would be a fast outcome through breeding schemes with quite high reliabilities of the breeding values. However, before we can implement this trait into the breeding programs, we have to know the genetic correlations to other economic important traits. Our master student, Gabriela Dott, looks at bovine spastic syndrome, or maybe known as crampy. I don't know, if I'm going into a stable in the dairy cattle, I immediately see a cow who is standing up and is cramping up, right? This disease actually has a prevalence of 3.6%. So in Canadian dairy cattle, where we have 1 million cows, this would be 36,000 cows. And this disease, there is no vaccination, there is no medicine. We can give these animals maybe something against the pain, but this disease cannot be cured. So it would be amazing if we could help, if we could maybe reduce the animals affected by this disease through breeding, right? In her studies, Gabriela showed that if we're choosing the bottom 10% of the sires, cows are 3.2 more times more likely to develop this disease. So it would be great to choose the top 10 sires to reduce the load a little bit. Colin Lynch looked at susceptibility and infectivity in calves. Now this is a trait which is broadly, which is so environmental, the environmental load is so important here, right? So how often do calves have contact with each other? How good is the management on the farms for diseases? We know that here genetics just plays a small part. But however, we can do better and we can help. And in his previous work, Colin showed that we can breed for calf diarrhea and respiratory disease. And he estimated the indirect effects, genetic effects of susceptibility and infectivity by creating different scenarios where he looked at the possibility how often calves might come into contact with each other and looked there at the heritability, and they went up to 7%. Now this sounds small, right? Because the environmental effects are so heavy on these traits. But if we're comparing that to an established trait, somatic cell score, which has a heritability of 10%, we saw in the past that with this trait, we could, as well as a geneticist, we can do meaningful impact on a health trait. Our PhD candidate, Ivan Campos, just handed in his PhD thesis and is defending it soon. He is looking at heat tolerance. Throughout the years, he could establish thresholds for heat stress or between different temperature humidity indexes. And he found the thresholds in milk traits between 50 and 65. He also saw that cooling systems might affect and may cause a genotype by environmental interaction. All these traits are combined in a Shiny app. Now, right now we have 67 traits where we estimated genomic and environmental relationships and correlations. And we can clearly see the relationships between these. It's phenomenon. No. Our great goal is that we could work together, close together with the industry, and implement our research solutions into genetic evaluation. If we're looking here, the fertility disorders, estrus activity, estrus intensity, estrus interval, size and position score, and anogenital distance are still studies. Because, for example, in the estrus activities, intensities and intervals, we're actually looking at sensor data. And we're combining that to hormone levels and seeing if we can easily measure these traits through sensor data. Bovine spastic syndromes is still a study. We have to know first the genomic regions who are expressing these traits, as well as Johne's disease and metabolizable energy intake in calves. Leukosis, calf disease, and calf diarrhea are right now under development to include in the genetic evaluation. And our diamond retained placenta, metritis, cystic ovaries, but also the environmental traits, dry matter intake, methane emission, body maintenance requirements are implemented into the national evaluation in Canada. With Canada being the first country to breed for methane efficiency. And it is so nice, and it's still overwhelming that from our research solutions, a new sub-index of the Lifetime Performance Index has been included with the sustainability or greenhouse gas emissions by Lactanet. If we're looking at this, we're having feed efficiency and body maintenance requirements to reduce feed costs, and methane efficiency to reduce methane emissions. But how did we do that? For the breeders in the room, we're having a single-step 4-trait animal model where we're using predicted methane. This predicted methane production is genetically independent of milk, fat, protein yields via a recursive model. But what does that mean? It means that methane efficiency helps to reduce methane production of the herd without impacting production levels. This was awarded to CEMEX, Lactanet, and the University of Guelph last year by the International Dairy Federation Innovation in Climate Action Award, as well as the University of Guelph Innovation of the Year. I don't know if you know that, but these awards normally don't go to geneticists. So this is a very big honor that we could also stand up there for the first time. But what do I actually want to tell you with that? If we're, phenotyping for dairy cattle resilience is only possible if we're doing it on a large scale. So if we're all coming together, if we're all working together, if we're helping each other, we can create something beautiful. Of course, a lot of partners throughout the industry, throughout academia are necessary to do that. But it is amazing to be part of such a large community. I have to do a little bit of advertisement. We have a scheduled summer course this year after a break from COVID. Professor Dr. Reinsch is coming and is showing us how to implement parent of origin effects into novel breeding goals. So if you're interested, we would love to see you in Guelph this summer. With this, I want to thank you for your time and your attention, and I'm eager to await all of your questions.
Joanna Jacinto from Switzerland. Thank you very much for your presentation. It was really nice. I wanted to ask you, for example, regarding the spastic syndrome, how do you classify the phenotype? Because I think, so for my experience, also talking with vets that work in the university, it's not always clear for everyone what's the phenotype and the definition, because then it makes it difficult to analyze at the genomic part. So.
Totally. It is very difficult. Right now we have, this is right now a study where veterinarians from the Ontario Veterinary College went out to the farms and they phenotyped it. And what they classified it as binomial traits, so they either gave a 1 or a 0, so if it's either there or not. we have to think maybe if there should be some scoring about that. But however, this disease is more of it's there or it's not, right? And we want to eradicate it. Our hope was that this would be maybe a mutation, but so far we found 9 different significant regions, so this will be not that easy to implement and to breed for, unfortunately, right now.
Thank you.
Yes.
Yeah. And the other thing is that I think sometimes there's like a misunderstanding and there's not a clear differentiation between spastic syndrome and spastic paresis.
Yes, so the thing is, yes, we have that as well. We defined it as paresis being in calves and spastic syndrome developed at 3 years or older right now. We have a data set for paresis as well. We want to look further into it and want to see actually if different genome regions are accounting for it. We're not at that stage, unfortunately, right now, but it's a great question.
Thank you very much.
A quick question. So far you're focusing on more or less traditional breeding methods. We have CRISPR technology, and as you know, in swine they've been able to knock out the receptor for the PRRS virus and make the animals very resistant. But it is coming up against public problems with acceptance. Do you see CRISPR eventually being a tool that we will actually be able to implement in the world?
In the future, definitely yes. I think, yes, it is a challenge to see if it's socially acceptable or if it will be not, yeah, if people don't want to have products from animals which were genetically modified. I think it is a story how we tell it. Because if you're looking at surveys where you're saying, oh, in hogs we can actually change the organs, so we can use the organs of the pig for our transplantation in the humans, it is directly accepted by society, right? The other part, if they're saying, oh, it's for the consumption, then they're less eager to consume an animal which is genomically changed. However, if we're looking again at bovine spastic syndrome, if that would be a mutation, a point mutation, we could eradicate this illness directly. Unfortunately, we can't. But I think CRISPR-Cas has so much potential, and looking at the swines right now, ASP doing that, who are we not to give pigs that opportunity to stay healthy?
Hi, I'm sorry, but my language is Portuguese, so if I say something wrong, I'm sorry. Thank you for your presentation. And I work with epigenetics, and I'd like to know what kind of methodologies do you use to quantify, for example, DNA methylation or something like that, more specific for epigenetics?
Yes. So, I mean, if you're interested, come to Guelph in the summer. Professor Ryan actually works so long on this topic, and he has built so many models to quantify these. What we're right now doing is Marc-André Zira looks at tools where we could actually use epigenetic markers and where we could genotype for these effects on a lower cost, and which is because right now they're really expensive and not practical for the farmers. He works closely together with Roger Q from the University of McGill, and they're looking also at maternal effects of the novel traits and intra-generational effects.
Hi, thank you very much. How do you sort of balance the genetic gain against the fact that longevity and the need to reduce replacement numbers, which is a massive driver in a reduction in carbon emissions? So at one level we want these cows to live longer and have less replacement, and level we're trying to speed up the rate of genetic gain. Where is the optimal culling rate going to be? Because something we're really struggling to sort of get our head around in developing policies.
Yes. This is always a difficult question, where to have the balance, where to have the cutoff, right? However, what showed in the past is that we can do better and we have to do better in the future. Breeding for production has been enormous and has been such a great example of how well we can do in our dairy cattle. However, there is such a need for the dairy cattle to stay fertile, to look at these traits for their longevity. I think if it comes to production level, we're at a good level. We don't need to, as in Canada, we don't need to have higher production in dairy cattle. We need better fertility. We need also looking at our sector. The sector needs to be sustainable. The consumers want to have a sustainable milk product. If we're looking back to Europe, the dairy ALA already implemented climate checks. The farmers have to check if they are sustainable. And by breeding for it, we can help getting to that goal a little bit faster.
Sorry, but the issue is, I would agree about production. And production for different units is probably fairly optimized on a lot of farms, but the point being, if you breed for longevity, you're reducing the rate of generational changes, so you're not going to speed up your genetic gain if you're keeping your cows for a long time and breeding less replacements, and that's the balance. We want our cows to live a long time and be healthy and not die on farm, because that's a massive cost. On the other hand, if we have a very slow turnover of cows, we're not going to achieve the very things that you are working towards here, and I'm trying to work out that balance.
That is totally correct. I think my father said that to me when I was little. He was like, farming is thinking in generations, not short term. Yes.
Well, we invite to watch the following video in order to respect the order of presentations.
Determinación de la calidad del calostro. Calostrómetro y refractómetro Brix. El objetivo de este video es mostrar el procedimiento detallado de la evaluación de la calidad del calostro a nivel de campo, mediante la determinación indirecta de inmunoglobulinas a partir de dos diferentes metodologías, calostrómetro y refractómetro Brix. Las becerras representan el futuro productivo del hato lechero, por lo que es fundamental establecer un programa de reemplazo exitoso que parta del manejo integral del calostro dentro de la unidad de producción. Determinación de la calidad del calostro. Calostrometría. El calostrómetro es la herramienta más utilizada para determinar la calidad del calostro y poder disminuir el riesgo de una falla en la transferencia de inmunidad pasiva por uso de calostros de baja calidad. Este método mide la gravedad específica o densidad del calostro y ha sido ampliamente aplicado para estimar la concentración de IgG, ya que existe una relación significativa entre su gravedad específica y la concentración de inmunoglobulinas, proteínas y sólidos totales. El calostrómetro posee una escala calibrada de colores, verde, amarillo y rojo, que dependiendo de este, otorga una categoría y un rango de concentración en intervalos de 5 miligramos por mililitro de inmunoglobulinas. Consideraciones. En condiciones de campo, el uso del calostrómetro se encuentra sujeto a una variedad de factores ambientales y de temperatura. Para una mayor exactitud en la estimación de la concentración de inmunoglobulina G, se tiene que evaluar el calostro en una temperatura de 22 grados centígrados, ya que a temperaturas más bajas se sobreestima la concentración de inmunoglobulina G por un incremento en la densidad, mientras que a temperaturas por arriba de los 22 grados centígrados subestima la concentración de inmunoglobulinas por una disminución en la densidad. Otro aspecto a considerar es la espuma del calostro, ya que ésta puede interferir con la lectura del calostrómetro. Material. Guantes de látex o nitrilo. Toallas de papel desechables. Calostrómetro. Probeta graduada de 250 mililitros previamente lavada y desinfectada. Procedimiento. Se deposita la muestra de calostro recién ordeñado en una probeta de plástico limpia con una capacidad de 250 mililitros. Se deja reposar la muestra por unos 10 minutos para disminuir la posible presencia de burbujas de gas. De ser necesario, se remueve el exceso de espuma. De igual forma, se espera hasta que la muestra alcance una temperatura de 22 grados centígrados. Se coloca el calostrómetro dentro de la probeta para poder realizar la medición. Este debe de mantenerse estabilizado y flotando, por lo que se debe esperar aproximadamente 3 minutos para realizar la lectura. Para determinar el resultado, se lee la escala numérica de miligramos por mililitro, clasificando la calidad del calostro, dependiendo del resultado obtenido. Resultados e interpretación. El calostrómetro que flota en escala verde corresponde a un calostro de buena calidad, con una gravedad específica de 1.047 a 1.075 y una concentración de inmunoglobulinas entre 50 a 140 miligramos por mililitro, apto para su administración a becerros recién nacidos. La escala amarilla corresponde a calostros de calidad aceptable, con gravedad específica de 1.035 a 1.046 y una concentración de inmunoglobulinas de 22 a 50 miligramos por mililitro. Mientras que un calostrómetro flotando en la escala roja está relacionado con mala calidad, una gravedad específica menor a 1.035 y una concentración de inmunoglobulinas inferior a los 20 miligramos por mililitro, por lo cual no puede ser administrado como primera dosis de calostro al neonato. En términos generales, la determinación de la calidad de calostro por calostrometría resulta muy adecuada a nivel de campo, ya que toma solo unos minutos para obtener un resultado. Sin embargo, es preciso tomar en cuenta la temperatura de la muestra y el riesgo que se tiene de romper el calostrómetro durante su manejo. Determinación de la calidad del calostro. Refractómetro Brix. El refractómetro de grados Brix es un instrumento fácil de utilizar a nivel de campo, que determina aplicando una sola gota de calostro el índice de refracción de la luz conforme pasa por la muestra, cuantificando en términos de porcentaje la calidad del calostro. Mientras mayor sea la concentración de inmunoglobulina G en la muestra, mayor será la refracción en la trayectoria de la luz. El refractómetro Brix es un instrumento menos frágil que el calostrómetro. El método es muy rápido y con un mínimo de equipo y experiencia, y no se requiere de una temperatura específica del calostro para su evaluación. Material: guantes de látex o nitrilo, toallas de papel desechables, refractómetro Brix, agua destilada y pipeta plástica. Procedimiento: antes de evaluar la muestra de calostro, se debe calibrar el refractómetro. Para la calibración se coloca una gota de agua destilada en el prisma del refractómetro. En caso de ser necesario, se requerirá girar un tornillo hasta que el punto de cambio entre la zona clara y oscura se ubique en 0%. Ya calibrado el equipo, se coloca una gota de calostro en el prisma del refractómetro, se cierra la tapa y se realiza la lectura del resultado, dirigiendo el refractómetro hacia un punto iluminado. Resultados e interpretación. El calostro que obtenga una puntuación Brix mayor o igual a 22% será apto para el consumo como primera fuente de calostro en los neonatos, mientras que un calostro con un porcentaje menor al 20% no debe ser administrado como primera toma. La prevención de la
Well, the next presentation is effects of Solanum, glaucophyllum, and calostrum salt boluses administered at Calving on plasma calcium concentration in cows' feeds diet with and without added anions by Jesse Goff from USA.
Okay. So before I give my talk, I want to make sure you all know that I am full of conflicts of interest. I invented soy chlor, which is one of the more popular anionics products that's used throughout the world now. It's made by our local farmers cooperative in Iowa. I designed, tested, and plan to produce, and eventually will market this. It's already going to be marketed in Mexico. The boluses that I'm about to describe to you. Commercial. I would like to be in Cancun when the snow is this deep in Iowa next year, rather than be in Iowa. I own a little company that makes vitamins for pigs, and we make products that we hope will make it into the human market someday for inflammatory bowel disease. So, everybody's on the same page. Normal blood calcium concentration of a cow should be between 9 and 10 milligrams per deciliter. For the Europeans, 2.25 to 2.5 millimolar. Take the millimolar number, multiply by 4, you will have milligrams per deciliter. So for clinical hypocalcemia or milk fever, fiebre de leche, the blood calcium concentration is generally going to be below 4.5 milligrams per deciliter, and that affects somewhere between 1 and 5% of the cows every year. These cows can't stand up. Their rumen motility is almost zero. They're not eating very well. They are highly immune suppressed, and that leads to more retained placenta, metritis, and reproductive problems, more mastitis. The fact that they don't eat means they're going to have more ketosis and more displaced abomasum. Overall, they will produce much less milk as a result of having clinical milk fever, and they have a shorter lifespan. Now, subclinical hypocalcemia is defined as a blood calcium below 8 milligrams per deciliter. We can argue about where that cutoff should be, but let's say it is 8 milligrams or 2 millimolar for cows during the first few days of lactation. That affects anywhere from 25 to 65% of the cows, depending on whose survey you read. These animals also have reduced rumen motility and dry matter intake. They're somewhat immune suppressed. It increases the risk of secondary diseases, and they don't make as much milk either. Jessica McCart at Cornell did a nice little field study where she looked at around 700 cows and their records of blood calcium concentration. And if we use our cutoff point of 2.0 millimolar as subclinical hypocalcemia, she noted there were some cows, the black line, who did not develop any hypocalcemia at all, no subclinical hypocalcemia. She noted some cows, actually the large majority of the cows, are in the red line. These cows have transient hypocalcemia. They're below our 2.0 millimolar, but by day 2, they are coming back above that number and recover quite nicely. There's a third group in the purple line. These are persistently hypocalcemic cows. They drop the day of calving, and then it may take them 3 or 4 days before their blood calcium concentration comes above the subclinical cutoff point. These cows have a very high risk of being culled on the farm, usually due to secondary diseases. In the green line, these are delayed hypocalcemic cows. There's a very small number of these in this study. They probably represent cows that develop metritis or mastitis and have some kind of an inflammatory process that's causing some degree of hypocalcemia. Now, the most interesting thing about this study to me was that the cows in the black line, who have almost no drop in blood calcium concentration, these cows made less milk than the cows with the red line, who were just transiently, temporarily hypocalcemic. Why does blood calcium fall in almost every cow? Well, cows make colostrum that has about 2 to 2.5 times the calcium content of regular milk. And if we add up the amount of colostrum and transition milk made on day 1 of lactation, that represents about 30 to 35 grams of calcium that is being removed from the bloodstream to support milk production. Remember, a large Holstein cow has perhaps 3.5 to 4 grams of calcium in all of her plasma. So we're asking her to turn over her plasma pool up to 10 times each day. So the better question is, why don't they all get milk fever? It's an amazing physiological feat. And the reason they don't is because they have a system called calcium homeostasis. And that revolves around anytime there's a drop in blood calcium concentration, it stimulates the parathyroid gland. The parathyroid gland produces parathyroid hormone, and the parathyroid hormone should act on the bone tissue and should act on the renal tissue. Those are its 2 main targets. In the kidney, it will reduce urinary calcium loss, but in the cow, that's a very small number, not very helpful. Its main action is to take this vitamin D that we feed cows or that's produced from solar irradiation of the skin. It takes that vitamin D compound and converts it into a bioactive compound called 1,25-dihydroxyvitamin D. And this compound is necessary for active transport of calcium across the intestinal tract. Now, if the intestine is absorbing calcium very efficiently, the bone is releasing calcium, very quickly the animal can bring its blood calcium concentration back towards normal concentrations. So why does this calcium homeostasis mechanism fail in some cows. Well, we know as cows get older, the risk for milk fever, hypocalcemia increases. We know that as they get older, they lose the vitamin D receptors in their intestine. Also, as they get older, their bone becomes much more in a resting state. Remember, the heifer, the vaccia, she is actively growing. She has lots of osteoclasts present in her bone. All she has to do is activate those osteoclasts, and so it's very rare for heifers to get milk fever. But a cow who has stopped growing, she's in her second or third lactation, she has very few osteoclasts in her bones. So she has to recruit osteoclasts and then activate them, and that takes time. And that is why they often get hypocalcemic in the first 24 hours after calving. We now know that prepartum diets that are high in potassium cause the cow to be in a state of metabolic alkalosis, and this alkalosis changes the shape of the parathyroid hormone receptor, so the kidney and the bone tissue do not respond to parathyroid hormone the way they should. Anionic diets induce a slight metabolic acidosis, and this improves parathyroid hormone sensitivity of the tissues. We also know that diets that are high in phosphorus block the ability of the kidney to take vitamin D and convert it to the bioactive form, 1,25-dihydroxyvitamin D. And we also know that if your diet is too low in magnesium, this prevents the release of parathyroid hormone, and it also acts at the level of the bone and the kidney cell to block the receptor activation at the kidney and the bone. So put it all together, we have situations where we have inability of the parathyroid hormone to do its job, either because we don't have enough magnesium in the diet or the animal's too alkaline. And we can have a situation where the animal cannot make 1,25-dihydroxyvitamin D because the dietary phosphorus is too high. Anionic salts are probably the most popular way to try to really prevent milk fever, I think, throughout the world right now. But it has difficulties. Every time the forages change, particularly the potassium content changes, you have to reformulate the diet. The pH of the urine should be checked frequently to make sure you're in a state of slight metabolic acidosis, not severe acidosis, and not alkalosis. You want to be in a slight metabolic acidosis state. Another problem is on many of the farms, we find that perhaps 80% of the farms in the United States, the heifers, primiparous cows, are being fed anionic salts along with the multiparous cows. There is no benefit of feeding anionic salts to heifers. There is a slight little benefit on udder edema, but it is not very repeatable, and it is not worth feeding it to heifers. In fact, meta-analyses by Ian Lane and Jose Santos have shown that the heifer-fed anionic salts will produce about 300 to 400 kilograms less milk in her lactation than if she had not been given anionic salts. So unfortunately, depending on the type of anionic salt product that's being used, you can affect dry matter intake in the cows. And if you reduce dry matter intake before a cow calves, you will see more ketosis and more metritis in the animals. Along come the oral calcium boluses as another way to try to prevent hypocalcemia in animals. Typically, the ones that are on the market right now supply between 30 and 45 grams of calcium in a highly soluble form. Usually it's calcium chloride coupled with something like calcium propionate, calcium sulfate. And the idea is only a small portion of this 30 to 45 grams will be absorbed, but it is enough to raise blood calcium a little bit, and it only lasts for 3 to 6 hours. So very often they say we need to give a second bolus at somewhere between 12 and 24 hours after calving. They're convenient, they're very easy to use. For pasture-based dairies, this may be their best choice of trying to prevent milk fever. For many of our very small farms, milking less than 50 cows, we still have those in the United States. Those farms cannot do an anionic salt diet very easily either. So here's what happens if you do not give a cow a bolus on a farm that is a typical dairy farm. Once you harvest that colostrum, blood calcium concentration starts to fall. And then by 12 hours, it is somewhat recovered in most cows. With the calcium bolus, you raise that blood calcium maybe 1 to 2 milligrams per deciliter, and it lasts maybe 3 to 4 hours, but by 12 hours, you cannot tell that you gave the cow the calcium bolus. You can give her another calcium bolus here, and it will rise again for 3 to 4 hours and go back to go back to a baseline state, as if you had not given her any bolus at all. Now, this is better than nothing. It can reduce the incidence of clinical milk fever by about 50%. Unfortunately, it does very little for the subclinical hypocalcemia animals. Solanum glaucophyllum, this is a plant that grows in South America. In its leaf, it contains 125 dihydroxyvitamin D, but it's in a glycoside form. There will be glucose molecules at several positions. When you feed it to a cow, the glucose molecules are cleaved off, liberating the 125 dihydroxyvitamin D. If failure to produce 125 vitamin D is a cause of milk fever and hypocalcemia, can we utilize this plant material to provide bioactive forms of vitamin D to the animal and help prevent milk fever? We decided to design this bolus. We used calcium chloride and calcium propionate in amounts so that we do not create an overly acidified cow. And this will maintain blood calcium concentrations for the first 10 to 12 hours after the bolus is administered to the cow. Then we add Solanum glaucophyllum leaf, and this will begin the process of active transport of calcium approximately 12, maybe 18 hours after the administration of the bolus. And that will carry the cow's blood calcium concentration for at least the next 72 hours. In this studies I'm going to show you, we have multiparous cows assigned to various treatments. Green line will always be 2 calcium and Solanum glaucophyllum boluses given one time right at calving or within 6 hours of calving. Oral calcium chloride commercial boluses, they are given at calving and then again 12 to 24 hours later. And then a third group of cows on at least some farms, they let us give no treatment whatsoever. First study was on a farm that was feeding an anionic diet. It was a Holstein Jersey herd, so we had about 50% Holsteins, 50% Jerseys. Solanum glaucophyllum bolus provided about 78 grams of calcium. The commercial boluses supplied about 50 grams of calcium, but they were given 2 times. Some cows received no boluses. So I'm presenting the Holstein and Jersey data combined. Here we see cows that did not get any bolus. Just as we expect, when you harvest colostrum, blood calcium falls, and then it recovered in those cows. Cows that got a commercial bolus, oral calcium only, yes, they're improved for the first 3 hours, but by 12 hours, indistinguishable. The cows that got the Solanum bolus, their blood calcium rises and stays pretty steady until 72 hours at the end of the experiment. Now remember our magic number of 8 milligrams per deciliter? You can see that the cows that got the Solanum bolus are the only ones who are staying above that magic number of 8 milligrams per deciliter. Another farm, now we want to see, remember that farm had an anionic diet. The anionic diet was supposed to improve blood calcium concentration. Here's a diet that does not contain anions. This is done in Torreon, Mexico. These, we made it a little tougher. We didn't include second lactation cows. These are third lactation and greater cows. So cows that are very susceptible to milk fever. We had 18 cows that got the Solanum bolus. None of them got milk fever. 12 cows that got the commercial calcium bolus. They got it 2 times at calving and 12 to 20 hours later. One of those 12 cows got milk fever, and then we had some cows that didn't get any oral calcium bolus. 2 out of 12 cows got milk fever. And here's their blood calcium levels. We didn't have a 3-hour sample. I expected at 3 hours the oral calcium bolus did give them a little improvement. But by 12 hours, you can see that the cows that got the oral bolus and the cows that got no bolus have essentially the same blood calcium profile. And if we use our magic number of 8 milligrams per deciliter, they get there perhaps by 96 hours after calving. The Solanum bolus cows, they jump up nicely. By 36 hours, they are at our magic number of 8, and they continue to stay above that the rest of the time. Now, another study I'm going to show here is 5 small farms located in the United States. These are small dairies, 50 to 100 cows. They could not use anionic salts very effectively, and so I'm going to pool the data from all these farms together. They were all using an oral calcium chloride type bolus. Some of the farms, they must have had learned when I was in veterinary school, every old cow you give a bottle of calcium to prevent milk fever. And so some of these farms were still giving intravenous calcium to the 3rd and greater lactation cows. We tried to get them to not treat any of the cows. Unfortunately, they only let us do a few of them because they were all getting milk fever. And so they quickly said no more of that. So let's start with the cows that had no treatment. There were 6 of them. 2 of them got milk fever. Their blood calcium started at 7. They fall down below 5. And then they slowly recover. They finally reach our magic number by about 36 hours after calving and stay very close to that line through the next 5 days. Cows that got intravenous calcium, this should be something you take home. Yes, on day 1 you raise their blood calcium, but by day 2, 3, 4, their blood calcium concentration is actually lower than if you had done nothing at all to those cows. And this is very much in line with what Noelia Silva del Rio saw in California. Treating with intravenous calcium is probably a bad idea. In the blue line here is the oral calcium bolus cows. Again, you see it maybe took 48 hours before they reached our magic line. And with our Solanum bolus, by 24 hours the cows had recovered and they stayed well above the magic line of subclinical hypocalcemia throughout the next 5 days. So, we know the bolus will work. It works better than IV calcium. It works better than the commercial oral calcium boluses. It's better than giving no treatment at all. And it has the effect that it works even in farms that cannot use anionic salt as a preventative. So we think this may be something that will provide a new tool to control hypocalcemia on dairy farms. And with that, I thank you for your attention.
We have time for one question.
No questions? That was clear as mud, right? Okay.
The next presentation is comparative use of automated behavior monitoring system, ABMS, versus on-farm standard operation procedure, SOP, for young health in commercial dairy farm, presented by Andre Preto from Portugal.
Okay. Is it working? Yeah. First of all, thank you so much for the introduction. Thanks for the scientific committee to allow me to present this talk. And by this, it's also my 4th opportunity to present in a World Buiatrics. And I just wanted to share with you a little story that I have. Because in 2008, I presented a study in Budapest regarding a novel lung lesion scoring method in slaughterhouses. And what we found back then was 55% of animals that went to the slaughterhouse would have lung lesions. 55% at the slaughterhouse, and we cannot do nothing with them at the slaughterhouse. After that, in 2012, we went to do a study with the late departed Professor João Canas da Silva, that was president of the World Buiatrics Association, on a study doing thoracic ultrasound scanning on heifers, that we could do something with them. And we found out that only 34% of animals that had lung lesions, they were alive, but only 34 were treated for respiratory disease. So I think this is a great, it's a lucky time for me to present you this automated behavior monitoring system, because not only helps us to check, but we are able to do things in life. We don't need to reach to the slaughterhouse. So starting up. Adapted from Giulia Giordano about precision livestock technology, we see that the impact is quite variable depending on the farms. So we have very low intervention farms with no SOPs, no standard operating procedures. We have high intensity and systematic monitoring farms. And in the middle, all the other ones. It's a huge variability. And the benefits of using a precision livestock technology, it's providing timely and precise identification of young stock to give TLC. Do you know who knows what's TLC? That's it. Tender and loving care. And we have an improved detection regarding what they have over there. But when we go to high intensity and systematic monitoring farms, the benefits, it might be less time dedicated to detection of disease, same level of detection, using your time to other stuff in the farm, and less animal management and less stress to the animals. So the biggest benefit on one farm, on one case, will be health and economics. The other one will be optimization of the workflow. So in regards to the objective of our trial, we wanted to compare both policies. The on-farm standard operating procedures with one vet, Marie-Louise, that was working over there full-time, twice a day, and comparing against automated behavior monitoring system, like the one that we see over there, that is based on SenseHub technology, SenseHub dairy, and we call it youngstock. So we wanted to compare about treatment usage, detection timing, workflow optimization, and in the end, the losses. So regarding materials and methods, we had quite a huge recruitment period, and you will understand the reason why. We were able to recruit 805 animals, divided in 408 animals to the control group, 397 to the what we call the shy group, or SenseHub youngstock group. The animals were sequentially random allocated on batches of 19 animals, and it even might have a question about why we did this, per group, per week, in order to ease the life of the workers. And what did we do in regards to health check of these animals? On the control group, like I told you, Marie-Louise, the vet on the farm, she was doing 100% observation of those animals twice a day using a modified Wisconsin calf scoring. And along the time, along the age, it would be reduced to one time a day per week. One time a day, one time per week temp check of all 100% of the animals on the control group, and after 5 months, observation once a day. On the treatment group, the shy group, we would use the health report that the system provides in order to have twice consultation of the health report, AM, PM, and it's basically the same until the 5 months period, between 5 and 8 months, where they would only work with the animals that were on the alert list. Following up, a little bit like these were the conditions. The animals were on a farm in Spain, pretty well followed up, individual housing, nipple suckling, and some of them had what you see on your right, 1 ear tag that when the lead is on, the animals are on the health report, so they should be, there should be a decision from the vet to treat or not to treat based on the alerts. So comparing the results, and these are the results that we have for neonatal calf diarrhea. Treatment with electrolytes, we can see that there are slight differences. On your left, it's the electrolytes with the shy group, the Sense-Up Youngstock, and on your right, with the blue, it's the control group. It will be always the same colors unless you're color blind and you're not able to distinguish the colors, but it's always written down. We don't have statistical differences between these two groups or the treatments of the two groups. And when we go to antibiotic usage, we also have numerical difference, no statistical difference, although we have a slight trend to treat a little bit more the animals with the automated device on the ear. So, but even so, when we do the contingency analysis, we don't see differences, statistical differences between the two groups. Following up, when we talk about pre-weaning animals and BRD, we have quite a huge difference. It's 20% of the animals were treated versus 9.8 pre-weaning. The average weaning age was 74 days. And it was quite impressive. It's statistical significant, the difference. And we are already detecting a little bit of a change on the pattern of treatment. But when we check the consequences of pneumonia, in reality, it was a lady that is seated over here, Carolina Tejero, did all the ultrasounds checking on this trial. Thank you so much, Carolina. But in regards to the impact that we see with the lung lesions on the ultrasound checking, we see a completely different pattern. And I'm going to change this into this slide. It's exactly the same information, only in a different format. So the difference is huge on the amount of animals that were decided to be treated by the vet, but also the consequences of having, for example, the grade 3, and I modified the scale, the grade 3, it means that the full lobe is completely affected, completely consolidated. And it's 3 times more than what we have in the animals that were using our system for detecting and trying to have a decision process. Following up, the contingency analysis it's different. We have good results, better results than the on-farm vet with the SOPs. And when we talk about post-weaning animals, the treatment pattern also is different, and we can see that there is numerical differences between the two groups. Obviously, the animals that were not treated pre-weaning, they will be treated post-weaning, or the decision of treatment will be taken by the vet on post-weaning. And we saw this on a really nice pattern, but also what we can see is the animals that were done the thoracic ultrasound scanning, we don't have so many differences, and it's not a statistical significant differences between the two groups of detection measurements. A huge amount of, if you notice, a huge amount of ultrasound checking, 1,282 ultrasound checking of every single animal on different ages. So we have a huge amount of data, we have a huge amount of data done and work done again in the farm. But no statistical difference on post-twinning. Again, like I told you in the beginning, there are huge differences between farms that do a lot of stuff, detection work, and farms that don't do a lot, that they don't have farm SOPs. For example, only for you to understand the impact of the farm SOP on the first BRD treatment. And this is where I would ask, but it would be too easy, when do you think that they temp check the animals, when they measure the temperature of the animals? Obviously, it's on Tuesdays, and they decide to treat the animals on Tuesdays based on temp check. And a part of all days of the week and working days of the week, the Sensab youngstock system has a regular detection pattern on all the animals that were on our group, on the group. Let's go. So, detection timing and what we were talking about patterns. And so you saw that I showed you that the two groups are quite the same size, and that's why I'm using here the number of treatments or animals treated individually on one day, and on the x-axis, it's the age of the animal. Usually we don't see a lot of data like this, and we have this data for the control group. We also have the data for the treatment group, for the Sensab youngstock group, and we already can see a difference in the patterns around here between day 32 of age and day 68. This one, the vet, the Wisconsin calf scoring done twice a day didn't allow the vet to take a lot of decisions during that time. And what we see is that the system allowed the vet to take decisions and treatment decisions that enabled to give and to treat earlier the animals on the treatment group. But it also changed a little bit the pattern, and again I'm going to reinforce the weaning was here, around 74 days. But we also see a pattern in the end on the older animals that we have a reduction of treatments on animals above 4 months of age. And it's interesting, it's not statistical difference, there is no statistical difference, but again, it's interesting to see that there is a change in the pattern of detection of disease. Continuing, workflow optimization, what I called search and diagnose, and then treat. And then at this farm, they have 4 females being born every single day. So if we think that they will be in hutches at least 70 days, we will have animals individually housed on hutches, like 280 animals. And if we think that we have the two systems, the control group and the Sensab youngstock system, what do we have to check? On one group, we will have to check every single animal. On the Sensab group, what we need to do is to check only the animals that are flagged by the system, trusting that the system is working accurately. And on this farm was doing around, on average, along the trial period, 8 animals per day, okay? Following up, or putting these into numbers, what we have control 140 animals on each group, saying that we take 0.4, we took the time to measure these, okay? Real numbers of this farm. 0.4 minutes per calf to do a quick check. So 56 minutes on the farm, going around the calves. Obviously, at the same time after feeding time, so it is our life or the vet's life. But then we need to do a clinical observation and the treatment decision. 3 minutes, it was the average time to make that clinical decision and the treatment decision. 3 minutes, around 3 minutes, so we add up all of these on a monthly time budget. We are talking about 40 hours per month on the control group, and in the Sensab, with the support of this decision tool, 12 hours per month. And it makes the difference between checking all the animals or checking every single animal. Again, it's a monthly difference of 28 hours, more 3 days per month of a worker, a very specialized worker that could be doing other stuff like analysis, data analysis, changes or adaptations on the SOP, so they could use that time to do other stuff. In regards to losses, again, final outcome. When we checked the control group and the Sensub Youngstock group, and here counting losses with deaths and culling, and I'm going to say, if you know all the stats, and I'm assuming that you know, not wrongly, the recommendations that we have is mortality below 5% until 9 months. This farm is a really, really well-managed farm. They do a really good job. And we could see that between deaths and culling, there is a 62% reduction of losses just by having this support tool on the farm to the vet to use. And it's not statistical. There is no statistical difference, but there is a statistical trend. And it's quite impressive when we have something like this. Even to have 1% of death rate in one farm up to 9 months, it's almost unbelievable. But we also found that, and you all, on these trials, people put a lot of care, not only on the control group, not only on the treatment group, but also on the control group. So they really, really, really performed really well. So, as a conclusion, when we talk about neonatal diarrhea, we didn't have statistical differences between the treatment groups, the control group, and the Sensub Youngstock group. In regards to BRD, we found out that we have earlier detection, earlier treatment decisions by the vet that can bring a long-term impact with the losses. We also saw that we can also improve lung health with a huge difference at pre-weaning. And the optimization of the workflow, I think it's quite self-explanatory. And the point of focusing the animals on the right animals that need support, I think it's a great point. And this creates a great homogeneity of diagnosis, not employee dependent. A lot of the farmers that we've been talking along these years, they panic when the worker goes on vacation. So this gives them like a pathway to follow with different workers. And the overall farm improvement of both sides of the livestock and the employee welfare, I think we got gains in regards to the usage of the system. I have to thank again the huge and incredible team that even in COVID times we were able to meet on the farm with masks on and all the stuff that we did on COVID times. I really extend the thanks to Carolina. Thank you so much, Carolina. And Laura, that they helped us a lot. To Mariluz, that she was doing the hard work, the boots, and the overall work on the farm, measuring all the stuff that we asked her to do. And Eran Friedman, that is our animal researcher in Israel, with a great job. He was part of the training set, doing and creating the algorithms. And thank you so much for being here. I hope that you are able to have questions.
We have time for 2 questions. Please.
Thank you very much for the presentation. So you saved a lot of days of workers. But in countries where the workers are, cheap, maybe you cannot convince the farmers to buy it. On the other hand, if you put the save of the treatments, how is the return of investments of these devices? So
these are two different questions. One is about workflow optimization and the workers being at lower costs if we have easy return on investment. I'm not going to tell you the way that I'm going to answer is not directly on this trial, okay? It's our experience on different trials. We did a huge trial in the US, and unfortunately the worker he went on vacation, and he was not able to return. He went on vacation to this exact country. He was not able to return to US, and I don't need to say why. He was not able to return, and the farmer was panicking because his best worker, it was like he was scoring like this. I have this great worker, he's able to detect sick animals. I have two other workers that they are great complying what the other guy is saying to them. Treat this, do not treat this, go and do this, okay? So they were able to execute, they were not able to check the animals that were sick. So even if the manpower is cheap, the farmer, if he didn't have this system being used, and we were doing a trial over there, I said, you completely saved my life because I lost my best one, even if it's cheap or expensive, okay? Here, Mariluz, during summertime, she took like 3-4 weeks on a farm, and she was not replaced to the same level. She's a little bit more expensive to the farm, but there was no Wisconsin calf scoring twice a day on that farm being done. So the level of investment and like the backbone that you are able to get with a system like this doesn't work without people on the farm. It doesn't work. It's like giving an hammer to a child, right? And everything will be a nail. So we need to be trained. People will need to use the tool properly to take the proper decisions of treatment, okay? That's one of the things. And we didn't evaluate. I don't have numbers to say to you about return on investment. The second part was the return on investment, the treatment. One of the things that we could have showed you, we were treating animals 12 days earlier in regards to BRD. So doing a little bit of math, quite easy. If we treat animals 12 days that are growing, to ease my life with math, okay, I'm going to say that they are growing 1 kilo a day. So if on average we were treating 12 days earlier, on average, they would have like 12 kilos less. The numbers that I showed you are number of treatments, not total volume of treatment, okay? So when we do the math about the total volume of treatment, we also have benefits that compare to the control group, okay? So we will have benefits that although the numbers are no different, number of treatments, we don't have statistical difference at some of the occasions, we do have the total volume used on the farm, okay? That was lower. I hope that it answered your questions. Okay, thank you so much again.
Well, the next presentation is predictive characterization and somatic cell count of Holstein cows under intensive grazing in the Querétaro highlands in Mexico, presented by Daniel Alonso Domínguez Olvera from Mexico.
Hola, buenas tardes a todos. Bueno, como ya nos mencionaron, sería el verde continuar, ¿no?
Continuar, regresar.
Y láser. Perfecto. Bueno, yo les voy a presentar mi trabajo, que fue una caracterización del conteo de células somáticas en relación con algunas variables, unas variables productivas en un hato en condiciones de en condiciones de pastoreo intensivo en el altiplano queretano, ¿no? Como objetivo, nosotros teníamos la intención, o tuvimos la intención de evaluar cuál es la relación entre el conteo de células somáticas con las características técnicas del mismo hato. Pero estamos implementando algunos métodos de aprendizaje automático que son del tipo clásico. En cuanto a materiales y métodos, nosotros obtuvimos la colección de datos a partir de 612 muestras de 49 vacas durante 4 años. De ahí se evaluaron 8 variables, que fue número de lactancia, duración de la lactancia en días, periodo vacío, ¿no? De que paren hasta que se vuelvan a cargar los animales en días, el periodo seco, el intervalo entre partos, también medido en días, el momento de la lactancia en días también, y la producción de leche en kilogramos. Y se hizo la evaluación del conteo de células somáticas. Bueno, respecto a la caracterización, utilizamos el método de aprendizaje automático clásico, que vendría a ser componentes principales, el cual tiene como objetivo reducir las columnas de la matriz de realización. ¿Qué es esto? No es otra cosa que reducir las variables, ¿no? A partir de las variables que estamos observando se hace una conformación con las correlaciones entre las variables y nos genera nuevas variables no correlacionadas entre sí, que se llaman componentes principales. En cuanto al análisis clúster, reduce el número de hileras de nuestra matriz de realización. ¿Qué es esto? De los individuos los agrupa por semejanzas, no es otra cosa más que eso. De ahí, en cuanto a los criterios de ajuste para nuestros métodos de aprendizaje automático, en cuanto a lo que fue la reducción de variables a componentes principales, nos quedamos todas aquellas que tuvieran un criterio de retención de los Eigen valores mayor a 1.0. En cuanto al análisis clúster, nos quedamos con todos aquellos clúster que se generaron a partir de 1.01 distancias euclidianas, ¿no? ¿Por qué euclidianas? Porque fue bajo el método del vecino más cercano. Ahorita vamos a ver. Bueno, todo esto fue en el Centro de Enseñanza, Investigación y Extensión en Producción Animal en el Altiplano de la Facultad de Medicina Veterinaria y Zootecnia de la Universidad Nacional Autónoma de México. Respecto a resultados, estos son las medias y sus intervalos de confianza de la estimación de esas medias en general, independientemente del clúster que se generó, independientemente de cualquier clasificación que se pudiera dar. Vemos que el número de lactancia en promedio fue de 2, la duración de la lactancia en promedio fue de 346 días, el intervalo para preñez fue de 134 días, el periodo seco fue de 62 días, el intervalo entre partos fue de 408 días y el momento de la lactancia en donde fue evaluado en promedio fue de 175 días. La producción promedio de este hato fue de 20 kilogramos. Y el conteo de células somáticas, que es una variable que tiene una alta variación, aquí no se ve reflejada en el intervalo de confianza, pero si nosotros, que me faltó poner el coeficiente de variación, veríamos que anda alrededor del 90%, ¿no? Y lo vamos a ver al momento de los componentes principales. Bueno, respecto al análisis de componentes principales, en donde el objetivo es reducir las variables, agrupándolas por sus correlaciones y generando unas nuevas variables no correlacionadas que se llaman componentes, tenemos que En cuanto a los autovalores de retención que nosotros establecimos en nuestro criterio, que fue mayores a 1, fueron 4 componentes los que cumplieron esta condición, de los cuales 4 componentes explicaron alrededor del 90% de la variabilidad de los datos. Por eso es que nos quedamos con 4 componentes principales. Y al evaluar aquí los autovectores que están afectando a cada uno de los componentes, las diferentes variables, vemos que el número de lactancia está componiendo al componente 3, el periodo seco al componente 3 y la duración de la lactancia al componente 1, días abiertos componente 1, intervalos entre partos componente 1. Por otro lado, para la producción de leche y milk production y ¿qué quedamos que era el otro? Y el momento de la lactancia están constituyendo al componente 2. Y el componente 4 únicamente está conformado por la variable suma, conteo de células somáticas, perdón. Entonces, en términos generales podemos decir que el componente 1 está constituido por variables de periodos de lactancia, el componente 2 por variables de producción de leche, el componente 3 por periodos de lactancia y periodos secos, y el 4 por conteo de células somáticas. Respecto al análisis clúster, nosotros establecimos que nos íbamos a quedar con los grupos que se generan a partir de 1.01 distancias euclidianas, ya que usamos el método del vecino más cercano, ¿no? Y entonces nosotros, al establecer esa medida, tenemos que corta 4 líneas de nuestras agrupaciones. Por lo tanto, nos quedamos con 4 grupos conformados. Aquí los estamos viendo. Grupo 1, vemos que es el que tiene más observaciones. Grupo 2, el que le sigue. 3 y 4 son pequeños. En ese sentido, si nosotros sacamos los estadísticos descriptivos, no descriptivos, solo la media de cada uno de los grupos, tenemos que en cuanto al número de lactancia, el grupo 2 fue el que tuvo el mayor número de lactancia. De ahí le siguió el grupo 4 y el grupo 3 y 1 no tuvieron diferencias significativas. Aquí no están, pero aquí deberían de estar las literales, ¿no? Que están diciendo si sí o si no tienen diferencias estadísticas. Pero bueno, básicamente nos ayuda a ver el perfil de cada uno de los grupos que se generaron a partir del análisis clúster. Y lo que resulta más relevante para nosotros es que el grupo 3, que tiene estas características en promedio, son los que tienen una mayor cantidad de células somáticas. Y esto es interesante porque al nosotros evaluar algunas características productivas, podemos adelantarnos a tratar de predecir la cantidad de conteo de células somáticas, que es un referente sobre la salud del hato, ¿no? Entonces, al graficar los componentes y juntarlos con las agrupaciones que generamos a través del análisis clúster, vemos que el grupo rojo, que vendría a ser el grupo 2, vemos que está en valores positivos sobre el componente principal 1, que quedamos que era periodos de lactancia, ¿no? Acá lo vemos, pero ahora con el componente 1 en el eje en el eje Y, el 4 en el Z, y bueno, aquí me interesa ver el 4 en el en el X, componente 3, componente 4. Aquí vemos el componente 4, ¿no? Que son el conteo de células somáticas, y vemos que el grupo verde, que era el 3, está más adelante, que precisamente son los que tienen el mayor conteo de células somáticas, los que podríamos decir que tienen cierto grado de alguna mastitis, ¿no? Acá lo estamos viendo otra vez, el componente 4, vemos el grupo 3, que son los verdes, y los azules vemos que en el componente 3, que son variables de periodos de lactancia y periodos secos son los que están afectando, o bueno, son los que están más hacia la derecha en cuanto a sus valores positivos de este componente principal, ¿no? Acá podemos ver que en el componente principal 1, que fue los periodos de lactancia, aparentemente el grupo 4 son los que tienen los valores más bajos, ¿no? Aquí vemos que en el eje X están hacia los valores negativos el grupo azul, que es el 4, y en el componente 1, que son periodos de lactancia. Sí, periodos de lactancia. Entonces podríamos ver o podríamos decir que los periodos de lactancia, que quedamos que era el número de lactancia, componente 1, duración de la lactancia, días abiertos y intervalo entre partos, que son variables altamente relacionadas, vamos a encontrar que en el grupo 4 son los que tienen el menor valor, ¿no? Aparentemente son duración de la lactancia, tienen la menor duración de lactancia, tienen los intervalos entre partos aparentemente más pequeños sí. Y bueno, aquí me falta esta comparación que sí estaba, pero no están las literales. Pero bueno, el punto es de que a partir de estas variables nosotros podemos determinar, bueno, más bien no determinar, sino esperar que van a tener un conteo de células somáticas, ya sea medianas o un nivel bajo, mediano o alto, que al final esto se refleja en que pueden tener una mastitis subclínica, ¿no? Y ya nos ayuda para, a partir de estos datos, sin necesidad de hacer la prueba del conteo de células somáticas, determinar si son propensas a tener este conteo de células somáticas alto y ahí empezar alguna acción, ¿no? También en cuanto a manejo, tratar de cambiarlo, ajustarlo a los que están presentando un conteo de células somáticas más bajo, que en este caso es nuestro grupo 1, que estamos viéndolo aquí en color negro, y vemos que en cuanto al componente 4 está más hacia la izquierda, ¿no? En valores negativos, porque al final el componente 4 está constituido de la variable conteo de células somáticas. Y bueno, ya como conclusión podemos decir que los métodos multivariados que usamos, que son parte de aprendizaje automático clásico, nos ayudan a caracterizar las variables productivas y ver su asociación con el conteo de células somáticas, ¿no? Al final, pues de eso se trata. Queremos, aplicando estos métodos de aprendizaje automático, ayudar a describir los fenómenos. Y bueno, a partir de los componentes podemos encontrar qué variables están afectando directamente a la variable que nos interesa estudiar, ¿no? Que son el conteo de células somáticas. Y bueno, de mi parte sería todo.
Someone has a question?
Muchas gracias.
Well, the next presentation is tool to estimate body weight and growth in dairy heifers, presented by David Alejandro Contreras Caro del Castillo from Mexico.
Hi everyone, thank you. I'm really happy to be here. Well, first of all, I would like to thank all the collaborators that worked in this experiment. Emily Alberg was my master student who is currently working in Sweden. All this experiment, we did it in Sweden. We worked at the research facilities at SLU in Uppsala. And we started discussing about having different tools to estimate body weight when you don't have access to a scale, and also trying to figure out how growth is happening on heifers. Well, as an introduction, I would like to point to this statement. The heifers of today will become the dairy cows in the future. And this statement, it is basically something that we need to reinforce into farmers, because there are things which avoids farmers to give the importance that the heifers have in farms. Basically, we think that they are very expensive. And this is true because they are the second highest contributor towards the cost, the overall cost of milk production. But nevertheless, farmers should see these heifers as an investment because of what we already said. We have a non-productive period, which is in some places more than others, especially, for example, in Sweden. They have an average time at first calving of 27 months. And it's been said in the literature that the main goal would be to get calves at 24 months, right? Which would be great for the overall management of the farm. But this sometimes doesn't happen everywhere, including, I think, in Mexico. But that would be the main goal. And then we need to evaluate growth rates in these heifers, because if we don't have the adequate growth rates, we would get heifers that reach puberty later, and then everything starts shifting towards getting animals that reach our goal later rather than sooner, and this will affect the time and all the operation in the farms. And then which tools do we have to monitor growth? We already saw the previous presentation where they show us a sensor to evaluate behavior on heifers or calves. And these, well, obviously they come with a cost, right? But there are some other tools that our producers can use. And therefore, the aim of our work was, to evaluate different tools to estimate body weight and growth in dairy heifers. The study was made, as I already mentioned, in Sweden, and we did use 165 dairy heifers of 2 different breeds. 96 of them were Swedish Red, and 69 Swedish Holstein. They were in a loose housing system, and they are divided in different groups depending on the size and weight. And the age was from 6 to 19 months, and the feeding was silage, water, and concentrate on group 1, which were the youngest. These are, on this table, I want to show you the different body measurements that we used. There's a small description on each one of them. I'm not going to read them all, but I just want to show you the 9 different ones, the description, and the equipment that we used. We use a measuring tape. Probably some of you know this, the weight by breed tape, which is made for American cattle, but we use them and they seem to work very well. The other thing that we used was the height stick, which is this one. And this actually, when we got this one, it's mainly used in horses. When we try to ask for one for cattle or dairy cattle, they told us, well, you can use it. It's the same basically. And the other thing was the hypometer. I don't know if some of you know this piece of tool, which is very easy to use and very friendly, and it turns out to be very accurate. So I would recommend to use this one. The statistical analysis that we made was taking into account the heifers with a full set of all manual body measurements, and the body weights, which were taken from a scale. We made Pearson correlations to investigate the relationship between each one of these body measurements and the body weight. Here I can show you some pictures. This is my student, Emily. She's taking the height from the shoulders, and here she's using the hypometer. And on this picture, we can see the diagram of all the different measurements that we made. Some of these measurements have been already been described in previous studies, but there's one, this one, the hip ischial width. This one has never been done before, and it's quite interesting what we found. On this table, we can see the results, and the one that I would like to point out is the one that I just told you, the hip ischial pin, which had a correlation of for the Swedish Holstein, 0.85, and for the Swedish Red, 0.8, which is probably not the best, but it is still good. And the ones that had the highest correlation were the hypometer, which showed 0.91. It was similar on both breeds. The chest girth, which has been the one recorded with the highest correlation, showed us a similar correlation. It's a bit higher on the Swedish Holstein. And well, this is just to point out that we used the measuring tape, and then we converted this to the kilograms that are stamped on the measuring tape. And on this graph, I would like just to show you the percentage of the growth rate per age in months for all the weighings in both breeds. Here, well, we basically we can see that on some of the dates where we collected the measurements, we can see that probably this would be something that points out that the animals had negative growth rates. So this, I would say that we can explain this because there are variations every time you take the measurements. This work was done by Emily, my student, and myself. We did it both all the time. We tried to do this, basically every time we did it, we tried to take all the same steps every time. And even though that we did the same, some of the measurements were negative on some points, but most of them showed that the animals are having a growth rate, especially during 7 and 11 months. So, as I mentioned, the highest correlations found were between the body weights recorded by the weight scale and the chest girth tape, and also the hypometer. So these results agree with previous works, and especially this publication by Dingwell from 2006, where they found correlations of 0.94 and 0.92 for the chest girth tape and the hypometer, where they measured the same things, but they only did it on Holstein heifers in, I think it was America actually. And this study included heifers from 2 different breeds, which are slightly different because they are adapted to Sweden. But we believe that this helps. And our conclusions are that the manual collection of several body measurements can be valuable to estimate the body weight. However, we know that these methods are largely time-consuming. Most of the time, it took between 2 to 4 hours to take all the measurements on the animals. And we would like to point out that automatic tools for monitoring growth on dairy heifers are crucial now, and especially to follow up and make take decisions into management. So this work could give us some insight into which of the body measurements could have the potential to be automatized, and then with this evaluate the growth of dairy heifers. And with that, I think I still have some time, but I would like just to give acknowledgement to the Faculty of Veterinary Medicine where I work. I got a grant, a scholarship grant, to do a sabbatical stay in Sweden at SLU, where I did this sabbatical stay, and De Laval, who also collaborate on this experiment. And with that, I am ready for question if there is any. Thank you.
Someone has a question?
No questions. Well, You have 5 minutes. Thank you.
The final presentation of the day is analysis of inline registered milk fat to protein ratios as biomarkers for assessing metabolic status in dairy cows, presented by Ramos and Tanaitis, from Lithuania.
Okay, thank you very much. I'm Ramūnas Antanaitis, and today I'm going to present our study which we conducted in one Lithuanian dairy farm. And this study is about inline milk fat protein ratio for assessment of metabolical status of dairy cows. But first of all, I would like to introduce what they are as innovative technologies and how we can use them for assessment of metabolical status or maybe health status of dairy cows. And here you, in the right side, you can find summarized information about these innovative technologies. And if you want to find more information, you can scan this QR code, which you can find information about precision livestock farming. This is one of our publications published in 2023 in journal Animals. But generally speaking, we have a lot of sensors, and with the help of the sensors, we can register a lot of data. And here you can see some sensors, some examples of sensors. For example, we have tail sensors. With the help of the sensors, we can register body temperature, cow activity, heat time. Also, we can predict calving time based on this information. Also, we have air sensors. With help of the sensors, we can register body temperature, cow activity, and rumination time. Next one is nose bend sensors, and with this sensor, with help of the sensor, we can register more than 30 parameters. For example, cow activity, rumination time, drinking time, eating tubes, and others. Also, we have some such as inside sensors, for example, rumen or reticulorumen sensors. And with help of the sensors, we can register every 10 or 5 minutes, we can register reticulorumen temperature, cow activity, also reticulorumen pH, what is very important for assessment of acidosis in dairy cows. Last but not least, it is select sensors. With the help of the sensors, we can register cow activity, we can register activity change, and other parameters connected with cow's activity behavior. And some statements about innovative technologies or precision livestock farming. We know that farmers can improve productivity, cow health, and reproduction success by using data generated by smart farm equipment. And precision livestock farming has important function in dairy farming, and this importance, we can say that increases in each year. And automation and robots have the potential to play a significant role in helping in dairy farm. And let's focus on milk, and maybe major question is, could milk serve as biomarker of cow health? Or maybe we can use this biomarker for assessment of cow health status. And one Lithuanian company named by Boluses Airline, they created a milk analyzer, and with help of this milk analyzer, we can register milk composition. It means milk fat, protein, and lactose concentration. Also, we can calculate milk fat protein ratio. And this is, can be installed directly in milking station or milking robots. And this milk composition are calculated from milk absorption spectrum. And here in these three pictures, you can see how this milk analyzer looks like in different milking system. For example, on the left side, you can see this milk analyzer installed in a Delaval milking system. In the right side, it is installed in another one milking system. And in the bottom picture, you can see how it looks like in Delaval milking robot. We can see that it's quite simple milk analyzer. And some technical note that milk composition, it is measured during each milking every 5 seconds. And this milk analyzer was evaluated in Eurofin's lab with quite good results, and values of root mean square error of prediction was 0.21 for milk fat and 0.90 for both for milk protein and milk lactose concentration. Here is only example, and this picture is taken from software, Boluses Healthline software. And here we can see some information about some health performance, feeding performance of our cows. And this all information is provided based on milk, fat, protein, and lactose concentrations. And for example, here on the right side, we can see some averages of milk, fat, protein, and lactose concentrations. In the middle, we can find information about some numbers of cows with suspected subclinical ketosis or maybe subclinical acidosis. And in the left side, we can see some average of milk fat protein ratio. And if we want, we can track, we can find information in historical information a few days ago if you want this information. And maybe major question is why we did this study. And we know that some health issues, for example, such as subclinical ketosis or subclinical acidosis usually happens in early stage of lactation. And for identification of these health issues, we have some biomarkers such as gold standards, for example, beta-hydroxybutyrate and NIFA concentration, it's nesterified fatty acids concentration. We have this biomarkers for assessment of metabolic status, high level of negative energy balance, and also for ketosis as well. Also, we have for assessment of subclinical acidosis, we have some also a few biomarkers. One of them is pH of rumen, of reticulorumen. And yes, and according information provided in literature, we created hypothesis and aim of the study. And hypothesis was that by analyzing milk composition data collected by inline sensors, it means that collected by this milk analyzer, which we saw before, we can maybe develop a method for assessment of metabolic health status of dairy cows, and especially focusing on subclinical ketosis or subclinical acidosis. And according to this, the aim of the study was quite simple, to find some changes in this milk-fat protein ratio, some differences between cows with subclinical ketosis or subclinical acidosis, and also we looked at some association or correlation between milk-fat protein ratio and some blood biomarkers. And short overview about our materials and methods. Like I said before, we conducted this study in one large Lithuanian dairy farm. In this farm, there are about 1,160 cows. And from these cows, we selected 320 for this study. And those cows was from 5 to 30 days after calving, second and more lactation. And from those 320 cows, we selected 96 suitable for our study. And from those 96 cows, we created 3 groups. And first group was subclinical ketosis group. Second one was subclinical acidosis group. And third one was clinical healthy group. And in first group, they were 62 cows in subclinical ketosis group. In second one, it was 14 cows. And in last one was 34 cows. And we registered milk composition every milking. By using this milk analyzer, and we collected blood samples every week, two times per week. And from blood biomarkers, we looked at BHB concentration, it means beta-hydroxybutyrate concentration, gamma-glutamyl transferase activities, aspartate aminotransferase activities, concentrations of albumins, and nestorified fatty acid concentration, it means NIFA. And about our results section, we found some differences between the three groups in milk fat protein ratio, and we found higher milk fat protein ratio in subclinical ketosis group, and lower milk fat protein ratio in subclinical acidosis group, but also from blood metabolical profile, we found higher NIFA concentration in subclinical ketosis group, and higher activities of liver enzymes such as aspartate aminotransferase and gamma-glutamyl transferase in subclinical acidosis group. If you're talking in numbers, we can state that the average of milk fat protein ratio in subclinical ketosis group, it was 1.66, while in subclinical acidosis group, it was 0.96. And in clinical healthy group, it was 1.2. And these results completely agreed with literature, which says that the average physiological level of milk fat protein ratio is about 1.2. And in case of subclinical ketosis, we have increase of this parameter. And on the other hand, if we have subclinical acidosis, we have decrease of this parameter because of milk fat depression. And if you're talking in percent, we can state that cows with subclinical ketosis had 36% higher milk fat protein ratio, and cows with subclinical acidosis, they had lower this parameter, and this parameter decrease of 23%. And let's back to blood parameters, and we can state that NIFA concentration in subclinical ketosis group it was higher, and the average of this parameter was 0.52, while in clinical healthy group it was 0.31. And this also completely agreed with literature, and we know that NIFA concentration, it is such as gold standard for assessment of negative energy balance, and we can see that in this group, subclinical ketosis group, as cows also had problems with negative energy balance. Maybe this negative energy balance caused this subclinical ketosis. And we calculated few correlations, and two from them was statistical significant. And first of them was association between days in milk and milk fat protein ratio. This association, this correlation was -1. It means that by increasing of days in milk fat protein ratio decreases. That means that higher risk of subclinical ketosis, it is in early stage of lactation. This is also not surprise, but all results confirm this information. And next one association, and maybe the most important association in this study, our correlation from the study, was that we found quite strong correlation between blood NIFA concentration and milk fat protein ratio. It was positive correlation. It means that by increasing of NIFA concentration, blood NIFA concentration, milk fat protein ratio also increases. And maybe because of this, and based on these results, we can use milk fat protein ratio for assessment of negative energy balance, because we know that NIFA, blood NIFA concentration, it is such as biomarker for assessment of negative energy balance. Also, we calculated a few more correlations, but they were not statistical significant, and we also found some changes, but this was not important for us. And some conclusions from this study, that we can conclude that inline milk fat protein ratio, we can use for identification cows with some metabolic problems, especially high level of negative energy balance. Also, we can use this inline milk fat protein ratio for identification of cows with high risk of negative energy balance, because of this association, like I mentioned before, that milk fat protein ratio has a strongly positive relationship with blood NIFA concentration. And also we can use this inline milk fat protein ratio for identification of cows maybe suffering or maybe which have some higher risk of subclinical acidosis or subclinical ketosis. And like I said before, that cows with higher risk of subclinical ketosis had higher milk fat protein ratio of 36%, and cows with subclinical acidosis had lower milk fat protein ratio of 23%. And another one conclusion, it is that maybe we can use this analysis of blood biomarkers and milk biomarkers all together, I mean, for assessment of metabolic status in our routine practice, in our daily practice. And because of milk samples are taken non-invasively, it is making them suitable for assessment of metabolic status in routine practice. And some advantages and disadvantages of this study. Few advantages that this is non-invasive method and we can use, it is simple to use, it's not stressful for cow and also veterinarian as well. And we can, with registered milk composition, we can assess metabolic status or metabolic profile. Also, early detection, it means that according results from this study and results of our past studies, we can conclude that some changes of milk fat protein ratio, it happens some few days before clinical symptoms. And this is also very important when we making some early detection or early diagnosis of this disease. And some disadvantages that this milk fat protein ratio can be influenced by other parameters such as breed, milk production, feed, and heat stress. And because of this, we conducted new one study, and this is our new study about impact of heat stress on inline milk fat protein ratio and metabolic profile in dairy cows. And this study was published in 2024 in Journal Agriculture. Also, you can find here QR code, and you can look at found more information. Yes, and also, last but not least, and maybe most important, disadvantages from this study is that we need to validate a subclinical acidosis model. What I mean, that we have to maybe found some connection or association between milk fat protein ratio and rumen or reticular rumen pH. Because in on this study, we found some, like I said before, we found a quite strong association between NIFA concentration and milk fat protein ratio, that in our new study, we will try to find some association between rumen pH, reticular rumen pH, and milk fat protein ratio, and we will try to validate this model as well. Yes, and what next? We noted from this study and from a lot of studies, we noted very important to make some early diagnosis and for example, if you're talking about subclinical acidosis or subclinical ketosis, and but what happens after that, after when we made some diagnosis and performing some treatment, and what happens after that. And here we can see a few examples. These two cows, they had problems with subclinical ketosis in both cases, and we selected these two cows from this farm from 1,100 cows, and but we selected them according milk fat protein ratio. In both cases, this milk fat protein ratio was high. In this case, was 1.65. In this two more than 2. And we performed the clinical examination, and we diagnosed subclinical ketosis according BHB concentration in the blood, and we applied treatment. We treat the cows with monoenzyme, better known in Europe as Kexton. And what happens during treatment? We can see here, for example, in this case, this milk fat protein ratio decreased in few days. In this case, it's not works very well, but also after a few days or a few weeks, we have also decreasing decrease. This parameter also went in its physiological level. That what I want to say that According to this milk fat protein ratio, we can not only to identify cows with high risk of negative energy balance or something like this, but also we can track or assess our treatment success. And this is very important for us as well. And this presentation, it's created based on this publication. We publish results of this study in journal Animals in 2023. And if you want to find more information, also you can scan this QR code. And it's all. Thank you very much for your attention, and I will be happy to answer all of your questions. Thank you.
With these presentations, finally the session of today.
Your words cut deeper than a knife. Now I need someone to breathe me back to life. Got a feeling that I'm going under, but I know that I'll make it out alive if I quit calling you my lover. Move on. You watch me bleed until I can't breathe, shaking, falling onto my knees. And now that I'm without your kisses, I'll be needing stitches, tripping over myself, aching, begging you to come out. And now that I'm without your kisses, I'll be needing stitches. Just like a moth drawn to a flame. Oh, you lured me in, I couldn't sense the pain. Your bitter heart cold to the touch. Now I'm gonna reap what I sow. I'm left seeing red on my own. Got a feeling that I'm going under, but I know that I'll make it out alive if I quit calling you my lover. Move on. You watch me bleed until I can't breathe, shaking, falling onto my knees. And now that I'm without your kisses, I'll be needing stitches, tripping over myself, aching, begging you to come out. And now that I'm without your kisses, I'll be needing stitches.
Got those eyes staring to my soul. You get that smile when I'm giving you my all. The only thing ever knew is that I never know. I've had my time, man, it's on and now I gotta go. Yeah, I'll go you home. You be mine and I'll be yours. I just wanna let you know, in my mind I call you home. You'll be mine and I'll be yours. Yeah, I'll call you home. You'll be mine and I'll be yours. I just wanna let you know,